Orthopedic Hospital is the premier orthopedic institute in Ghana and West Africa. Over the past decade, and with the help of philanthropic donors such as Georgina and former Mayor of New York City, Michael Bloomberg, Focus has made significant infrastructural improvements while continuing to treat patients. This summer, we commissioned a 700 kilowatt solar panel with a 1 megawatt battery backup, making it the largest solar-powered hospital project in Africa. Our outpatient facility reviews over 6,000 patients annually from 53 countries and 6 continents. With the support of the Ghana National Petroleum Corporation and Mr. and Mrs. Wayne and Claire Hayland, we recently installed a state-of-the-art magnetic resonance imaging, better known as MRI, in our radiology suites. In addition, the Hospital for Special Surgery's donation of a 16-slice CT scanner enables us to obtain detailed imaging of the musculoskeletal system, including a 3D imaging of complex spine deformities. All operating rooms are fully equipped with modern orthopedic instruments and appliances such as a cell saver system, surgical lights, and intraoperative spinal cord monitoring machines, also donated by the Hospital for Special Surgery, which allows us to monitor the spinal cord function of patients during complex spine procedures. Intraoperative imaging with C-arms are also available when needed for orthopedic operations. In 2018, we opened the Wayne and Claire Hayland Children's Pavilion, which is fully equipped with modern monitoring systems and orthopedic beds to efficiently manage patients. At the Kofi Annan Children Education Center within the Hayland Pavilion, education is available for all local and international patients year-round. We implement on-site comprehensive educational classes led by our in-house full-time teacher. We're able to provide our dedicated hospital staff with convenient shuttle transportation to and from the hospital, thanks to the donations of Savavi Motors Company. The Focus Board, staff members, and patients would like to thank our donors for their generous support. You continuously help us help people stand tall. For more information about Focus and ways to support, visit focushospital.org. The Focus Orthopedic Hospital is the premier orthopedic institute in Ghana and West Africa. Over the past decade, and with the help of philanthropic donors such as Georgina and former Mayor of New York City, Michael Bloomberg, Focus has made significant infrastructural improvements while continuing to treat patients. This summer, we commissioned a 700 kilowatt solar panel with a 1 megawatt battery backup, making it the largest solar-powered hospital project in Africa. Our outpatient facility reviews over 6,000 patients annually from 53 countries and 6 continents. With the support of the Ghana National Petroleum Corporation and Mr. and Mrs. Wayne and Claire Hayland, we recently installed a state-of-the-art magnetic resonance imaging, better known as MRI, in our radiology suites. In addition, the Hospital for Special Surgery's donation of a 16-slice CT scanner enables us to obtain detailed imaging of the musculoskeletal system, including a 3D imaging of complex spine deformities. All operating rooms are fully equipped with modern orthopedic instruments and appliances such as a cell saver system, surgical lights, and intraoperative spinal cord monitoring machines, also donated by the Hospital for Special Surgery, which allows us to monitor the spinal cord function of patients during complex spine procedures. Intraoperative imaging with C-arms are also available when needed for orthopedic operations. In 2018, we opened the Wayne and Claire Hayland Children's Pavilion, which is fully equipped with modern monitoring systems and orthopedic beds to efficiently manage patients. At the Kofi Annan Children Education Center within the Halen Pavilion, education is available for all local and international patients year-round. We implement on-site comprehensive educational classes led by our in-house full-time teacher. We're able to provide our dedicated hospital staff with convenient shuttle transportation to and from the hospital, thanks to the donations of Savavi Motors Company. The Focus Board, staff members, and patients would like to thank our donors for their generous support. You continuously help us help people stand tall. For more information about Focus and ways to support, visit focushospital.org. The Focus Orthopedic Hospital is the premier orthopedic institute in Ghana and West Africa. Over the past decade, and with the help of philanthropic donors such as Georgina and former Mayor of New York City, Michael Bloomberg, Focus has made significant infrastructural improvements while continuing to treat patients. This summer, we commissioned a 700 kilowatt solar panel with a 1 megawatt battery backup, making it the largest solar-powered hospital project in Africa. Our outpatient facility reviews over 6,000 patients annually from 53 countries and 6 continents. With the support of the Ghana National Petroleum Corporation and Mr. and Mrs. Wayne and Claire Halen, we recently installed a state-of-the-art magnetic resonance imaging, better known as MRI, in our radiology suites. In addition, the Hospital for Special Surgery's donation of a 16-slice CT scanner enables us to obtain detailed imaging of the musculoskeletal system, including a 3D imaging of complex spine deformities. All operating rooms are fully equipped with modern orthopedic instruments and appliances, such as a cell saver system, surgical lights, and intraoperative spinal cord monitoring machines, also donated by the Hospital for Special Surgery, which allows us to monitor the spinal cord function of patients during complex spine procedures. Intraoperative imaging with C-arms are also available when needed for orthopedic operations. In 2018, we opened the Wayne and Claire Halen Children's Pavilion, which is fully equipped with modern monitoring systems and orthopedic beds to efficiently manage patients. At the Kofi Annan Children Education Center within the Halen Pavilion, education is available for all local and international patients year-round. We implement on-site comprehensive educational classes led by our in-house full-time teacher. We're able to provide our dedicated hospital staff with convenient shuttle transportation to and from the hospital, thanks to the donations of Savavi Motors Company. The Focus Board, staff members, and patients would like to thank our donors for their generous support. You continuously help us help people stand tall. For more information about Focus and ways to support, visit focushospital.org. The Focus Orthopedic Hospital is the premier orthopedic institute in Ghana and West Africa. Over the past decade, and with the help of philanthropic donors such as Georgina and former Mayor of New York City, Michael Bloomberg, Focus has made significant infrastructural improvements while continuing to treat patients. This summer, we commissioned a 700 kilowatt solar panel with a 1 megawatt battery backup, making it the largest solar-powered hospital project in Africa. Our outpatient facility reviews over 6,000 patients annually from 53 countries and 6 continents. With the support of the Ghana National Petroleum Corporation and Mr. and Mrs. Wayne and Claire Hayland, we recently installed a state-of-the-art magnetic resonance imaging, better known as MRI, in our radiology suites. In addition, the Hospital for Special Surgery's donation of a 16-slice CT scanner enables us to obtain detailed imaging of the musculoskeletal system, including a 3D imaging of complex spine deformities. All operating rooms are fully equipped with modern orthopedic instruments and appliances, such as a cell saver system, surgical lights, and intraoperative spinal cord monitoring machines, also donated by the Hospital for Special Surgery, which allows us to monitor the spinal cord function of patients during complex spine procedures. Intraoperative imaging with C-arms are also available when needed for orthopedic operations. In 2018, we opened the Wayne and Claire Hayland Children's Pavilion, which is fully equipped with modern monitoring systems and orthopedic beds to efficiently manage patients. At the Kofi Annan Children Education Center within the Hayland Pavilion, education is available for all local and international patients year-round. We implement on-site comprehensive educational classes led by our in-house full-time teacher. We're able to provide our dedicated hospital staff with convenient shuttle transportation to and from the hospital, thanks to the donations of Savavi Motors Company. The Focus Board, staff members, and patients would like to thank our donors for their generous support. You continuously help us help people stand tall. For more information about Focus and ways to support, visit focushospital.org. The Focus Orthopedic Hospital is the premier orthopedic institute in Ghana and West Africa. Over the past decade, and with the help of philanthropic donors such as Georgina and former Mayor of New York City, Michael Bloomberg, Focus has made significant infrastructural improvements while continuing to treat patients. This summer, we commissioned a 700 kilowatt solar panel with a 1 megawatt battery backup, making it the largest solar-powered hospital project in Africa. Our outpatient facility reviews over 6,000 patients annually from 53 countries and 6 continents. With the support of the Ghana National Petroleum Corporation and Mr. and Mrs. Wayne and Claire Hayland, we recently installed a state-of-the-art magnetic resonance imaging, better known as MRI, in our radiology suites. In addition, the Hospital for Special Surgery's donation of a 16-slice CT scanner enables us to obtain detailed imaging of the musculoskeletal system, including a 3D imaging of complex spine deformities. All operating rooms are fully equipped with modern orthopedic instruments and appliances, such as a cell saver system, surgical lights, and intraoperative spinal cord monitoring machines, also donated by the Hospital for Special Surgery, which allows us to monitor the spinal cord function of patients during complex spine procedures. Intraoperative imaging with C-arms are also available when needed for orthopedic operations. In 2018, we opened the Wayne and Claire Hayland Children's Pavilion, which is fully equipped with modern monitoring systems and orthopedic beds to efficiently manage patients. At the Kofi Annan Children Education Center within the Hayland Pavilion, Education is available for all local and international patients year-round. We implement on-site comprehensive educational classes led by our in-house full-time teacher. We're able to provide our dedicated hospital staff with convenient shuttle transportation to and from the hospital, thanks to the donations of Savavi Motors Company. The Focus Board, staff members, and patients would like to thank our donors for their generous support. You continuously help us help people stand tall. For more information about Focus and ways to support, visit focushospital.org. The Focus Orthopedic Hospital is the premier orthopedic institute in Ghana and West Africa. Over the past decade, and with the help of philanthropic donors such as Georgina and former Mayor of New York City, Michael Bloomberg, Focus has made significant infrastructural improvements while continuing to treat patients. This summer, we commissioned a 700-kilowatt solar panel with a 1 megawatt battery backup, making it the largest solar-powered hospital project in Africa. Our outpatient facility reviews over 6,000 patients annually from 53 countries and 6 continents. With the support of the Ghana National Petroleum Corporation and Mr. and Mrs. Wayne and Claire Hayland, we recently installed a state-of-the-art magnetic resonance imaging, better known as MRI, in our radiology suite. In addition, the Hospital for Special Surgery's donation of a 16-slice CT scanner enables us to obtain detailed imaging of the musculoskeletal system, including a 3D imaging of complex spine deformities. All operating rooms are fully equipped with modern orthopedic instruments and appliances, such as a cell saver system, surgical lights, and intraoperative spinal cord monitoring machines, also donated by the Hospital for Special Surgery, which allows us to monitor the spinal cord function of patients during complex spine procedures. Intraoperative imaging with C-arms are also available when needed for orthopedic operations. In 2018, we opened the Wayne and Claire Hayland Children's Pavilion, which is fully equipped with modern monitoring systems and orthopedic beds to efficiently manage patients. At the Kofi Annan Children Education Center within the Hayland Pavilion, education is available for all local and international patients year-round. We implement on-site comprehensive educational classes led by our in-house full-time teacher. We're able to provide our dedicated hospital staff with convenient shuttle transportation to and from the hospital, thanks to the donations of Savavi Motors Company. The Focus Board, staff members, and patients would like to thank our donors for their generous support. You continuously help us help people stand tall. For more information about Focus and ways to support, visit focushospital.org.
Good morning to you all. Good morning, ladies and gentlemen, distinguished guests. Thank you so much for making the time to join us this morning for the first annual Health and Development Forum. Before we begin, I'd like to introduce myself. My name is now Kylie Adamafio Mantiao. I'll be your co-MC for today's event, and I'm here with my colleague,
Kwabna Asante Ofe.
Okay, thank you. Before we begin, I'd like to acknowledge the presence of some distinguished guests who are here with us. First, we have Dr. Yvonne Urenchua Eseku. She's rector for the Ghana College of Pharmacists. Welcome, Madam. We also have Madam Perpetual Oforian Pofo. She's president of the Ghana Registered Nurses and Midwives Association. Thank you so much for coming, Madam. Then we have Dr. Mrs. Joycelyn Aziz. She's Director of Pharmaceutical Services at the Ministry of Health. You're welcome, Madam. We have Dr. Mrs. Martha Jansa Lutrots, former Director and Technical Coordinator at the Ministry of Health. Thank you for coming, Madam. And then I'd also like to acknowledge the individual who's made all of this possible for us, the convener of today's program, Pham Abraham Jesse, the CEO of Health and Development Consult. Thank you so much, sir, for making this possible. Ladies and gentlemen, next on the agenda, we have remarks from our chairperson. Our chairperson is a Ghanaian pathologist. He's an academic, politician, and social commentator. He's a well-known, strong Nkrumahist who believes in the ideals of Dr. Kwame Nkrumah, its founder. He is a professor of pathology, like I said, and he's an advocate on lifestyle issues. Distinguished guests, please join me. Welcome to the stage, Professor Ajiman Bedu Akosa, our chairman for this event.
Good morning, Nana. Good morning, ladies and gentlemen. It is good to be here this morning. If for nothing at all, it is important that the health team is giving oxygen every now and then. And this is what my dear brother, Pham Abraham Jesse, has continually done for the last 20, 25 years. Many people do not know, but to treat one patient, the number of professional groupings that have got to act to ensure that that patient gets better. In the last 20 years or so, the British Medical Association indicated you needed 69 professionals. If they do not work as a team, that child will not get better. And of the team, nobody is better than anybody. Because the slightest error that one person makes can lead to a catastrophic error. And that is why we always say that health, we work as a team. And this team must be giving sustenance every now and then, because some people forget. And whether you like it or not, some people are very parochial. They like themselves, they like what they do, and they believe that nobody else comes even closer. That is human, unfortunately, that is one of the negative sides of human endeavor. And you can criticize it, but you can't do much about it. But so long as constantly we give ourselves cause to believe that if whoever works with us in the team doesn't do what is right, whatever we do will be wrong. That is the sustenance that my dear brother continues to give to the health team. And this forum is meant to achieve nothing but, let me say, the everyday dose of sustenance to ensure that we all work it together. I am very, very, very pleased to be here. This is something that we've discussed over 20, 25 years, and we continue to do it. but I would want to say that he is an extraordinary person, somebody who has focused his attention on how it is that some people can get better health outcomes than others. And so long as we begin to play a parochial game, we're not going to achieve the health outcomes that all of us want to achieve. So from Abraham Jesse, God bless you. You do it so well. And I think that it's important that all of us as health professionals should follow. He's done it. He'll continue to do it. But so long as life has an end, there will come a time when he will be alive, but he will not be as strong enough to do it. Who is there to continue this periodic sustenance? So I want to welcome everybody. We have a very enjoyable program. Everybody just sit down quietly, humble yourself, and listen to what it takes to make a very good team. Good morning, and let's enjoy it. Thank you.
Thank you so much, Prof, for that speech. I was actually going to do a small introduction, but I feel like you've done that for me. So I will just go ahead and call on our convener for today's meeting, Farm Abraham Jesse, to please give us the welcome address.
Thank you, Nana. Professor Chairman, Nana Professor Hianyi of Otumfuo Osei-Tutu II, Chairman of the Board of Trustees of the Osei-Tutu II Foundation, and President of the Focus Orthopedic Center, and I dare say one of the best orthopedic surgeons the whole wide world has ever seen and known. Thank you so much to start with for gracing the occasion with your royal presence. And we also do recognize that you are wearing two hats, one for yourself and one for His Royal Majesty Otumfuo Osei-Tutu II. You have had to travel all the way from Kumasi. You flew in by air last night with your executive director, who's a very hard-working lady. Could you please stand behind Nana? So, please. Thank you very much. She's the executive director of the Otumfuo Osei-Tutu II Foundation, a very hard-working lady, a very efficient lady, and he's a willing volunteer. He works out of his mind and out of his heart for the common good. That's what I can say for sure. All my distinguished resource persons, if I may, for convenience, start from my left. The rector of the Ghana College of Pharmacists, one of the most dynamic ladies this country has produced and will continue to produce. Just a little bit so we can recognize you. Yeah. And seated by her, she's a formidable lady, the president of the Ghana Registered Nurses and Midwives Association. She will disarm you with her style. And my colleague, Joycelyn Aziz, Mrs., who, because today she's representing the Honorable Minister for Health, is our pro-tem Honorable Minister for now. And of course, my chairman, Professor Ajnambudakusa. You see, Prof and I started this journey, like he said, 25 years ago. Our first endeavor was to host a similar meeting like this, but then it was done at the national conference, national theater, as we call it. He was at that time the guest speaker, and he told everybody to their faces that we either work together or perish. And that was at the height of the HIV and AIDS pandemic. And the idea was to see how best it is we can, working together, defeat HIV and AIDS. At that time, even doctors were scared of touching patients because they thought they would catch the disease. And Prof was able to dispel that notion and to encourage health professionals to give of their time and of their value and of their very best, work as a team in order to minimize the scourge of the HIV and AIDS. That's how we started. And Professor Fred Tsai, may he rest in perfect peace, he was then the presidential advisor on adolescents' health and HIV and AIDS. He was the chairman. So you see, that was a very high-powered meeting, just as we are trying to repeat here. And the consensus at that time was that health professionals were not doing nearly enough to bring comfort and succor to our patients. So we started a long time ago, and we are here today to deliberate on the need for teamwork among all healthcare professionals, such that we can improve healthcare delivery for the benefit of all our people. But since in today's world, no one is safe until all of us are safe, we intend that after our endeavors, whatever it is that we learn from here will be collated into a formidable publication that will be made available all over the globe. Because the things we're talking about here is not only for Ghana, we're talking about a necessary action the whole world must take. But everybody thinks everybody will do it, but nobody's doing it. So we've taken it upon ourselves to highlight this concept. You can have the best infrastructure, the best hospitals, the best equipment, the best specialists, the best drugs. What about the people working there if they are not at peace with each other? And this is why we've chosen for our patron for this meeting, none other than Professor Mahinba Boachaje II, who himself is a champion of teamwork. As you will soon hear and see, he, utilizing the concept of teamwork, plus all the other skills nature has endowed with him, came to Ghana to set up the Focus Orthopedic Hospital. It's a place to visit. It's a place to seek help if you need it. And years ago, when he came to launch the Focus program in Ghana, I happened to be his master of ceremonies when the program was launched at the La Palm Hotel. And you see, you can't see his face now, he's smiling. That smile is so infectious, and it gives hope to whoever sees that smile, that hope is alive. And when you get a chance to listen to him, you will know exactly what I'm talking about. And we have for our moderator, Dr. Mrs. Martha Jansen-Lutrot, recently retired coordinator, technical coordination in the whole of the Ministry of Health. So you can see she's a manager. She's a team maker. She knows how to get things done. And who else could we invite as our moderator? And I've got a very nice spare. Now, Kylie, thank you. And Kwabda, now Kylie is the country manager for Deng Pharmaceuticals, one of the most powerful pharmaceutical manufacturers in Germany. They introduce what you may call advanced generics that do work. And then next, my very good friend, the other MC, Kwabena Sancho-Ofe, the Vice President of the Pharmaceutical Society of Ghana. So I'm only trying to assure you that we are in very capable hands and that our time spent here will be very useful. It will be such as to empower us to continue to do what is best for our people. And you remember that there's this concept today going on that whether we like it or not, this is the only planet we have for now. People are trying to go to Mars. Well, let them continue trying, but at least this is where we are. There's a very popular gun phrase, Ahaniyewo. Now, can you help me? Now, there's a popular gun phrase, Ahaniyewo. Ahaniyewo. How do you say it? You see, Yapo Ahaniyewo. So, ladies and gentlemen, having said so, who am I, what do I represent, and why am I standing in front of you this morning? I've been a pharmacist since 1967. And during this time, I've spent all my working life in the pharmaceutical marketing with relevant experience in what is now being euphemistically referred to as Anglophone West Africa. And in all these years of my work, I have seen with my own eyes, I have felt with my own heart. Sometimes I have smiled. Sometimes I have nearly wept. I've seen how nice it is when health professionals work together to bring relief to patients who were previously mourning and now smiling and beaming with hope and a zest for life. I have also seen some of the worst animosities practically on the field when health professionals fight as if it's Putin and the Ukraine. And sometimes the worst things happen. But what we don't see often is the untold hardships, misery it brings. The duplication of efforts by all practitioners in the field in bringing succor and hope to our patients, it can be very sad. So when I retired from active business, then I said, I think I'm going to devote the rest of my time championing this cause of teamwork. You see, because without teamwork, nothing happens. The government will buy expensive drugs. There's no teamwork, so the drugs will expire. Expensive equipment will be bought. There's no teamwork, so the package in which they came in, they will remain sitting in that package until they rust, because there's no teamwork. But more importantly, the patient, who's the patient, who's the client, it includes me, it includes each one of us. So somebody must make noise about this essential ingredient, which is so necessary in bringing succor and relief to our people. And I've chosen to do that. And as Professor Ajman said, we started this journey together 25 years ago, thereabouts. So we want to discuss frankly amongst ourselves, and there are over 1,000 people on the line, I'm sure it's gone up now, who are also participating virtually. And this program, as I said, will be very well documented and it made available globally, free of charge. So let us learn what we can learn today. Let's observe carefully what we can observe today. Let us take to heart what we can take to heart, and let us commit, each one of us, that from now on, we will know that Ubiahu here, and no one is safe until we are all safe. Simple as that. So I must thank all of you for coming, such that we can have a very useful time together here and come out with recommendations that will make Ghana a better place to live in, that will make the whole world a better place to live in, because we live on this planet. Human beings, animals, the flora, everything, all the ecosystems must be in tune. I remember a song by Kwame Mpedu, if we work amongst ourselves together, respecting each other, knowing that everybody has got something to bring to the table, it is not just you see, Professor Kusa alluded to a story when 25 years ago we launched this program. He gave the example of an orchestra. everybody has a part to play. Some sounds may be more pleasing to you than others, depending upon who you are and the mood you are in. But essentially, it is when all the musicians are playing together in harmony that you understand, feel, and believe in the music. That is why it is said that music also has healing powers. So let us resolve, hopefully, that we shall all work together to be able to teach teamwork, to be able to promote teamwork, to be able to entrench teamwork, and above all, to be able to practice teamwork wherever we are in the healthcare domain in the supreme interests of our people. This is why we are here. So my organization is to introduce you very briefly what is Health and Development Consult. I've told you that since when I retired, I decided to do something more useful with my time. So I set up this organization, and our idea is to champion this cause of teamwork. But because I have reasonable experience as a pharmaceutical marketer, I also do some consulting in the area of business development for the pharmaceutical industry. And I love writing, so we write books. But the main purport is everybody has a role to play, and God has given each one of us a certain talent we must use for the glory of his name, and above all, for the benefit of our fellow creatures. So I invite you to listen carefully, and like I said, more importantly, observe and try and commit something in your heart that you will take over as your own and go out there and be a team player. Yeah. 6 feet and so let us learn to be humble. Let us give thanks to God for the talents he has given us. And let us be grateful that we are alive and commit that we have a job to play. And Health and Development Consult is appealing to you all. Teamwork is better than fighting against each other. And teamwork will bring hope. This is why we are not sort of leaving this to ourselves alone. Whatever happens will be appropriately documented and published, and we'll make it available to the whole world. So, Nana Professor, my dear Chairman and comrade in arms, in the supreme fight for teamwork, I thank you all for listening. Enjoy yourselves, enjoy your time, and may God bless us all for coming. Thank you.
Thank you so much, Famjesi. It's always such an honor to listen to him speak. I know recently he spoke with some of our younger colleagues in the pharmacy fraternity, and there's so much to learn from him. I'm not surprised at all that he started working on the Health and Development Consult and its related things for so many years now. A special welcome to those who are joining us online. We'd just like to acknowledge you at this point. If you have any questions, comments, I'm sure you should be able to share them with us online. Yes, they can, right? They can communicate with us if they have questions and stuff. Perfect, thank you. So for those joining us online, if you have any questions, comments, etc., please let us have them, and then we shall address them in the course of the program. Okay, so we will then, I'll call on Kwabena Sante then to do the next introduction. All right, thank you.
Thank you very much, now kindly. I have the singular honor to invite our patron to speak. Our patron is the board chairman of the Otumfuo Osei Tutu II Foundation. We actually know what the Otumfuo Osei Tutu Foundation has done tremendously. A very reputable organization, has had tremendous impact in our society, and he is the board chair of the foundation. And then he's also Otumfuo's Hiahene. So Otumfuo's Hiahene. That's a very important introduction I had to make. And he's also the president, as we've been told, and founder of Foundation for Orthopedic and Complex Spine Focus Hospital at Pantine, Ghana, and then the USA. And he's accompanied by his wife, lovely wife, Mrs. Hilda Boachi Ejay. Ladies and gentlemen, please help me welcome Otumfuo's Hiahene.
You can see it's a little struggle with the microphone, the glove, the bangles, and everything. The first time that I've had the opportunity to give a presentation of this nature with all three apparels. It's not a three-piece suit with a bow tie anymore, but thank God the mind is the same. You may be seated. Very happy to be here this morning to be part of this I would call forum, symposium, or lecture series on teamwork for better healthcare and sustainable development. I'd like to acknowledge the chairman, Professor Ajiman Bedu Akusa, a dear friend who I've known for many years. The first time I gave a lecture in this hall was 1998 when I started Focus Hospital. I was doing my exploratory work in Ghana if this was possible. And Prof has been with us all these times as either a guest lecturer or helping us navigate our ways through Kolebu Teaching Hospital. And the convener, Farm Abraham Jesse, thank you for the invitation. I also like to acknowledge our special guest of honor, the representatives of the Ministry of Health, the rector of the Ghana College of Physicians and Surgeons, which I say I was proud of being a member of his informative stages in 2003 when President Kufuor inaugurated the college, working with Professor Nyame when he came to the United States. And I was also part of the architectural design and construction of the Ghana College and where it is today. So I have a lot of history. And also the representatives of other units and specialties, and ladies and gentlemen. So this topic for teamwork is very relevant. As we all know, teamwork started in the Garden of Eden. Even God saw that Adam was not enough. So he gave him Eve as the first team that came into this world. I went to the United States when I was 21. When I got there, I got so confused. I said, oh, there's a lot of attraction here. I can easily be dissuaded. I can miss my target, but I have a mission, is to be an orthopedic surgeon and go back and help. But there's a lot of temptation. So I need a team member, and I called my girlfriend, Hilda, to join me. She was only 18. Next year, God will know, be 50 years that we've been together. And I will say that we have two MDs in the house. I'm the medical director. She's the managing director. But I congratulate the organizers for this forum. It's really good. Comprehensive healthcare is not one-stop shopping. A specialty, as we've heard from our two speakers. It's just like the human body is interconnected and comprehensive. So I'd like to take a few minutes to just give some definitions. What's teamwork? It calls for collaboration and interdependence. And when it comes to our field of medicine, it involves not just the doctors, but even private corporate entities, institutions, agencies, NGOs. They're all part of it. Public institutions, regulatory healthcare units, HEFRA. When I opened a Focus Hospital, and they said, well, you need 8 nurses and 2 doctors to be able to get HEFRA accreditation. So when I was an orthopedic surgeon, I'm very qualified. I can do every operation, but it won't work. And then we go into the operating room and I'm doing an operation and I cut the ureter and I'm not a urologist. How do I fix it? So I realized that before I could start anything, I had to assemble a team of experts because just going to the bone alone is not enough. Then I realized I need to really forge alliances with custom offices because when I brought the implants, I couldn't take it to the operating room right away. I need to go through customs, and customs have their regulatory units and quality assurance units and all of that. So I recognize that for an orthopedic surgeon, the minimum help that I needed was there's a maximum, and that comes to money. But you need an anesthesiologist, you need a neurosurgeon, you need a nursing, you need physiotherapy, you need pharmacy, you need dietary, infectious disease, medicine, pediatrics, gastroenterology, GU, pulmonary, ICU. So in the beginning, I just didn't say, well, I'm going to build a hospital. I said, no, I need to make frequent visits. And on these frequent visits, I partnered with Kolebu Teaching Hospital, where I knew that I could get all the help that I could get for a single patient that I'm going to straighten the crooked spine. I'm going to open, to straighten the crooked spine, but no, I needed a facility that had all the units that I could get, including blood bank. And I remember the very first patient who tested this hypothesis was my mother-in-law. I had done a trip, and we were on our way back to Kumasi to say goodbye to her, and she fell, she fractured her hip. So as an orthopedic surgeon, I could make the diagnosis because the leg is short and externally rotated. But I needed to confirm where the lesion was, which is an X-ray. And I needed to transport her from her house to the hospital, then I needed an ambulance. So this team was now coming into play. So I had to take her into a car, take her to Kumasi, Konfuanochi, get an X-ray. They said, well, she needs an operation. I know she needed an operation, but it couldn't be done in Kumasi. So I had to charter a flight, bring her to Accra. Then I remember the day before the surgery, I spent the whole night going from house to house, trying to gather the team that I had to work with. I knocked on everybody's door, the nurse department, the lab department, the radiologist, the blood bank. And then I realized after all that, I didn't even have the implant. So I called New York. And they had to put an implant on a Delta flight coming the next morning. So by the time we put in the hip implant into her hip broken joint, I had consulted like 35 individuals and spent a whole night for one patient with a broken hip. But we also know that a broken hip in an elderly patient has a 50% mortality. So I was either going to lose her or do all that work to save her, and she stay with us after her surgery for another 20 years before she said goodbye to us. Now, what's the cost of all of this? It costs a lot of money to be able to do all this. Even the implant coming from New York, because we don't have a manufacturing system here. And that's one thing we need to consider. How can we do all this work? And we have a College of Engineering, but we can't manufacture a screw that we can put into a patient. We should be able to manufacture a pedicle screw, because a pedicle screw is $800 for one, and a single patient may need 20 of them for a crooked back. So we say, well, we have an NHIS, forget it. Forget it. You might get paracetamol after you've done the surgery. It covers basic RPD conditions, hypertension, diabetes, malaria, pneumonia. But when it comes to diseases, it doesn't discriminate about your financial status. The village girl will get eye tumor. I went to US when I became chief just to do a tour of my villages. I saw this girl with a patch on her face. I said, what is this? She was having terrible, terrible pain. So I asked them, what was the problem? Well, they've taken her to Konfuanochi. She's had all the assessment. However, they think she has an optic nerve tumor or something wrong with her eye. said, well, okay, you can't do this here. She's in pain. She's only 14 years old. Your NHIS is not going to take care of this. Even the bandage, NHIS is not going to pay for it. So let me take her to Kolebu. So I brought her to Focus. We have a guest house. I brought her with her family to stay with her. Then I said, well, then take her to the hospital. She went to the Focus Hospital. Then they did a basic analysis and said, well, she needs to go to Kolebu. So I talked to the neuro-ophthalmologist. They say, well, she has an eye tumor that has to be treated. So what's the cost of it? She has NHI. They say, no, it's not going to cover that. So, all right. She's a card holder. Oh, it's not going to cover that. So, all right. So the NHIL is 2.5%. 70% of the revenue is 2.5% of all the taxes that we collect from companies. Social Security, 2.5%, 20% of the revenue. The premiums is only 3%. But her premium is not going to pay for her eye tumor. So I had to sponsor her. So she had the operation. I took care of her. And then she came back to Kumasi. And for them to say thank you, they brought me a bunch of yams and plantains. That's good. But if I sold it, I won't pay for her bills. But it was an appreciation. So the NHIS is not realistic when it comes to complex diseases. It doesn't at all. We can't pride ourselves by having a national health insurance system that is going to cover healthcare for all Ghanaians. No way. It doesn't. It doesn't cover brain tumor, open heart surgery, complex spine, orthopedics. Not even 10% of the charges quoted abroad, which is the cost of one business class ticket for a government official. Government official will go abroad for his or her health care. That business class ticket of $15,000 will put in one hip joint at Focus Hospital. Because we've been able to reduce it from $150,000 abroad to $15,000. But NHIS won't give you $15,000. Why doesn't it do that? I think we need to look at the system. Is it really realistic in covering the healthcare of Ghanaians? Not really. I don't say no way. It needs to be upgraded. Then even if it's to work, as we know it now, there are a lot of outstanding payments for services provided, which affects the bottom line for most healthcare providers. A lot of doctors and institutions complain that they are way behind in their payments. So then the next payers is going to be the private institutions. That's expensive and not affordable for everyone. It should be a supplement to the NHIS, but it really isn't. Even if you consider the corporate social responsibility, there's a limit for every corporate entity as to how much they can really give. We've had tremendous support from public institutions like GMPC, Ghana Gas, other institutions in the country who have supported our mission. Because Focus mission was to provide the best orthopedic care for all. But if NHS is not going to cover it, I have to raise funds from abroad. I have to take money from my own pocket to pay for patients. And luckily, we've been able to get institutions like the Ethiopian American Jewish Joint Commission to support Ethiopian children, not Ghanaian children, Ethiopian children. What about our children? Okay, so GMPC gives us money so we can buy an MRI scan, put up solar systems, so we can then support patients in GMPC operational areas. So it's collaborative, and that's one of teamwork. Teamwork doesn't mean just the doctors, but it's also the enablers. You know, we need an enabling environment, especially the government. Currently, before many years ago, I used to bring a physician from the US who would get donations of $1 million worth of equipment to come and do complex joint replacement. Where FDA said, can't do that unless the company that is donating the implants registers the implants, gives it the biodegradable components, how they got it. But this is an FDA-approved implant, just like the medications. It's an EMA, it has an ISO approval. And the company said, no way, we're going to donate this. It's $1 million. The American government is allowing us to use the system here. We need just, we'll give you the approvals that we have. So to date, we haven't had that approval, and patients are suffering because a donated implant is not allowed to come into the system. And so where's the team? The team is missing somewhere. So it's like a jigsaw puzzle. Every piece has to go in for it to work. So out-of-pocket payment is out of control. It's not realistic. If people are making $2 a day, they're not going to be able to spend $10, for healthcare, unless it's maybe malaria. So we have to realize that our healthcare system is not just to take care of communicable diseases. Non-communicable diseases are becoming very prevalent because our lifestyle is changing. People are not walking anymore. We all live in apartments. We have televisions. We have cars. We're frying eggs in the morning. So non-communicable diseases is coming up. And when that comes up, it goes into chronic illnesses, COPD and congestive heart failure and all of that. And NHIS is not going to take us through all of this. So we're going to lose more people and the population is growing. So that's teamwork. And to date, 500 international volunteers have visited the Focus Hospital just to provide help. So for the past 2 years, I haven't done surgery in the past 2 years. Some people ask me, "What, do you miss it?" I said, yes and no. They say, what's the no? What's the yes? The yes, I miss it because it was fun to be in the operating room and nobody bothers you. Now everybody bothers me. But no, say, oh, but I thought you were a surgeon. No, I don't miss it because why? I have trained people to do what I do. And for me, my goal was to leave somebody else to walk into my place. And if I can train people to do what I do and for them to understand the principles that I have set out, then I'm happy. I'm content. I don't have to do all of it because there's no way I was going to be able to save the whole world. So better health care, that can only be met by building on the 4 pillars of sustainable health. And that requires adequate human resource, proper infrastructure, robust health care financing, and properly managing complex diseases, both communicable and non-communicable. If you look at the first one, human resource, and this is all part of teamwork for better healthcare. The human resources. Do we have enough doctors, nurses, PAs? Recently, I heard on the news that the doctor to population ratio has improved from 1 doctor to 12,000 people to 1 doctor to 9,000 people. I think one of you gave that presentation. And that was very encouraging because it means that we're training more doctors, or we are keeping, and we're keeping those we're training, or people are coming back from the diaspora. And all three has to work for this to be possible for us to meet our human resource challenge. And there has to be a manpower development agenda in the country. Now, how many orthopedic surgeons do we need for Ghana? How many anesthetists do we need? How many pediatricians? How many internists? How many pulmonologists? That has to be a plan. That's the responsibility of the Ministry of Health, Ghana Health Service. As Prof was saying, if we don't have these subspecialties, who would then come together as a whole to take care of one patient, we will train a lot of generalists, and they will always hit their head against the bricks. The generalist is a generalist. Triage, that's fine. At some point, even PAs and nurse practitioners can do the initial screening, because not every patient that we see is going to require the maximum health care, because a lot of them can be managed by PAs, nurse practitioners, which will also take the burden off the physician, because the physician has to see someone who really, really is sick and has been screened by a PA or a nurse practitioner and say, well, this is the patient, and just tell me the story, and this is what the patient needs. So we need to improve on our human resource challenge, and that can only become by a concerted effort of the policymakers, Ministry of Health, and the Ghana Health Service, and looking into the future as to how many specialists we need and how many do we need for the rural communities, the district hospitals, the tertiary institutions. Unless that is planned out, we will train them, we will have no place to put them, and they will leave. They will see greener pastures. Recently, there was a comment in one of your publications that Nurses are leaving they're living abroad for greener pastures. Why should they leave? They shouldn't if we were able to hold on them into the workforce. There should be nurses in the rural areas, but it's not just going there. You go there with amenity where you have amenities. The doctors won't go to a rural facility when they don't have a bungalow, a school for their children, a car to be able to move around. That's why they all stay here. That's why Kolebu is jammed. That's why Komfanochi is jammed. Why? Because the doctors want to stay around where they can go to the national, international schools and all of that. So we need to also improve the environment where we are sending these people with the proper infrastructure that they can work in. I believe it was Mrs. Ofori Ampofu that made that comment. The nurses are going abroad. Is that correct? Yeah. And I think you were trying to encourage them, but that shouldn't be. But he also commented that we needed 45,000 nurses, and that number hasn't been reached yet for 32 million people. So we need physicians to understand this. So there's a need to establish a national manpower development program. That should be the overarching goal, to build capacity for sufficient healthcare delivery to reach the World Health Organization targets for universal healthcare. Now, infrastructure. So teamwork is not just the people working about where you're going to work. You can have the best physicians, specialists, put them into an empty room, and they will not be able to exhibit or demonstrate or do anything unless they have the proper tools. So it comes with a building. The building comes with supplies. Supplies come with equipment. The equipment comes with biomedical engineers who can fix them when they break. There's a CAT scanner focused hospital that's been broken for the past 8 months. No engineers. Why should that be the case? There should be biomedical engineers who can fix equipment so when they break. So modern facilities, refurbished facilities, and the maintenance of existing facilities. Here in Ghana, we kind of lose track of maintenance, and it's everywhere, seriously. You go into any institution, the mammography equipment is broken. Kolebu CT scan is broken, and it's 3 months before it gets fixed. So we're not looking at the people who can maintain our infrastructure for us. When I was a kid, I traveled from Kumasi to Takoradi to Accra, back to Kumasi on the same day. How could I do that? By the train, with the train, the railway. We had the express, we had the sleeper, and we had the local. And they moved people and goods. Where are they now? We didn't maintain them. Even if we couldn't build new ones, we couldn't maintain what we had. And the same thing has happened with our healthcare institutions. So we need to also invest in robust information technology. Telemedicine is one area that can also improve our teamwork. We can send a message to a rural physician who can send back an image. I remember when I was in the United States, I got a call from a friend in South Africa that her friend in Nigeria had had a car accident and broken her spine. So I said, through the WhatsApp, I was actually in the lecture hall just like here. So through the WhatsApp, this is the benefit of mobile devices and technology. So I said, have your friend send me a copy or the x-ray. So she WhatsApped the friend, took a picture of the x-ray, sent it to her in South Africa. She forwarded it to me in Virginia. So I looked at the x-ray and said, well, this is a spine fracture. Your friend needs an operation. Send her to Ghana. So she sends the message back to them, and they said, but who do we see in Ghana? So I sent a WhatsApp message to Dr. Boata Kolebu. I said, this is a spine fracture, needs internal fixation. The patient is in Nigeria, so contact her. So through that triangle, in 24 hours, the patient was on the operating table at Kolebu, having surgery. And she got better, did her rehab, recovered from her paralysis, went back to school, and did her master's, and is back in Nigeria. That's the basic telemedicine. But now it's advanced. So what investments are we making in telemedicine, which can also help with healthcare, better healthcare delivery, since not all of us could be in the rural area. So all that is very critical. We can also establish health maintenance organization systems like Kaiser. That's a cooperative effort. Columbia Health, United Health. It's been done in the United States and it works very well. Government support for private institutions. So when I look at Focus Hospital, sometimes I cringe a little bit and say, why? I say, well, it becomes a swim or sink operation. We call in investors. We want people to come and invest. So they should come and build only factories? Or they should just come and just build real estate? What about healthcare? I have gone to the United States. I have spent a lot of my money. I have gotten my friends, convinced them to help me bring specialty orthopedics. I have built a $25 million operation here without the government's input, except $1 million that Dr. President Kufuor gave us to acquire the land. But we have to survive. So from now on, what happens? I only have one line from ECG. So when Dunso comes, I don't have any power. So I go to the president and say, please, can you give me 2 lines, 2 phases? So go see another person. It doesn't work. So my lights go out, and then I have to put a generator on. And then I'm behind in my ECG bills, and the ECG comes in, they cut off the power. Where's the enabling environment? It's discouraging. So unless you have a heart to do well, you'll be discouraged. Because the teamwork is not just me and the multi-specialists, but it also involves the public institutions. Who is looking to see that these hospitals are surviving? Because we are providing good health. Nyaho, Lister, they are struggling to really deliver adequate and good health care. It's expensive. It's not cheapo, it's expensive. And who's going to pay for it? It's expensive. People can't afford it. And not all of us have malaria. Even it's the #1 killer, we have other killers too. Breast cancer, brain cancer, urological cancer. So you have an end-stage kidney disease. Is NHS going to pay for your dialysis? No. If you need transplant, what's going to happen? I would love my loved one to have a kidney transplant. Recently, one of my chiefs had to sell a piece of land to travel to India to get kidney transplant. And we have surgeons here who can do kidney transplant. So we have to, the policymakers have to think and really reconsider the agenda. Prevention, early intervention, community health education programs, centers of excellence, especially for infectious diseases. We saw that when COVID-19 hit our country. Were we really prepared? Did we have centers of excellence in infectious diseases to really do the work that needed to be done? We're very, very lucky that we didn't meet the consequences of the disease like the United States. We were so lucky. Maybe it was the sun. And we should be happy about that. Otherwise, we would have been wiped out. But should we wait for the next pandemic? No. There should be investments in advanced laboratories, pharmaceuticals, testing, vaccine development. All that should be on the government's agenda. So after we've gone through better healthcare, then sustainable development to achieve the sustainable development goals. That requires structural investments in healthcare delivery, which must be comprehensive and integrated to prevent, detect, and respond with the extensive healthcare systems that follow international norms. If you can't do all this, then you can't sustain it. You should be able to prevent it, detect it, respond adequately with the most extensive healthcare system. COVID-19 led to the launch of the Global Health Security Index. Most of you have heard about that. It's a comprehensive assessment and benchmarking of health security and related capabilities to address one of the world's most omnipresent risks, that's infectious diseases and outbreaks. So out of 195 countries that were assessed, we scored 104, so we're way low. And our overall score was 34. 34 is too low. The best was Japan. It's like 90 something. It means Japan is ready to prevent, detect, and respond. And we scored 34, so we need to improve it. Okay. The Sustainable Development Goals aims to end poverty, protect the planet, and ensure prosperity for everyone by 2030. This is 2023. We're talking about 7 years. 7 years. Are we going to be able to meet that? No way. We have to apply for extension. If nobody does, at least we need to apply for extension. Are we ready to eliminate poverty by 2030? The goal is to ensure that people stay healthy so they're able to work, enable them to earn money and support themselves and families. That's what it really means. Are we ready by 2030? No. So healthcare must be accessible and affordable. Policymakers to strengthen public-private partnerships, robust job placement for healthcare workers who will become breadwinners for their families, eliminate and reduce brain drain. If we can do this, then maybe we can eliminate poverty. You just don't get rid of poverty by giving people money. No, by making people healthy so they can work to afford, to put bread on the table. That's how it works. The second goal is zero hunger. Balanced nutrition is essential for good health. So if you're hungry and I give you rice, you will be hungry. You won't be hungry, but you won't get healthy. So we need a balanced diet, which means agricultural systems improvement in that environment and industry to bring balanced nutrition, safe and healthy agricultural practices for food production, preservation, processing, distribution. That's how we can aim towards approaching zero hunger. But now we're importing most of our rice. We're importing most of our oil. So if we don't transform the lands that we're using for illegal mining and all those other practices and plant food, zero hunger by 2030 is way out of reach. You won't get there. And the third goal is good health and well-being, which really hits home our profession. And that's based on the 4 pillars that I have mentioned already, which is human resource, state infrastructure, healthcare financing, and managing complex diseases. That's how we can get good health and well-being for our citizens to reach the Sustainable Development Goals by 2030. And then the 4th goal is quality education. For us, it's manpower development, which is basically the human resource aspect. So we need to develop manpower in basic and advanced healthcare education and training. We need more specialists in all the areas, in pharmacy, in nutrition, in nursing, in oncology, all areas. So basic education for all persons with disability too, and establishment of and support of centers of excellence. If you can do all these, then hopefully the goal of having teamwork for better healthcare and sustainable development will become real in our lifetime. Thank you very much.
Wow, what a speech. I mean, he has succeeded in expanding the scope beyond what we're traditionally thinking about regarding, teamwork among healthcare professionals. But he's gone into every aspect. At the end of the day, I think the conclusion is that for us to achieve that one goal of development in healthcare, everybody must come on board, whether healthcare or not. And you've done excellent justice to that, sir. Thank you very much. And on a lighter note, when he was speaking, I was thinking that, is he really sure that he's Ghanaian? And then at some point he said, it's not cheap. Oh. Then I realized, oh, okay, that's the Ghana right there. Anyway, but then also one thing I noticed was that he, as a person, has done so much, has contributed personally to development in various, through healthcare, but then impacted several areas as well. And we owe him our thanks. And so the entire Ghana is grateful to you, sir, for all that you've done. And my people will say that Ghana mang se wadawase, Ghana adeshemanga yen sumo bi nango bi English ya kuyabeng. Dienga fru kuku bi esan kuku bi engusari woso edom bi tipsi yen suru Ghana mang se dawase. And now we Kumasi intine se yeka Kumasi e dia mpofrenchia wunum subing yo korbi esan te kotoko kuma pema pembeba. Enya kuya fre kotoko hina jimango kofrobo. Ututu ya pe musrampam se chi oba konka wasem akwajina mwate chirifa denche mwediatra machemfu ya kuya kona. Ya chi ahimana no yukuni o yoku ya bushe muhine brempong o yuku piesie santimansus wadawase. Na one kran suntina nkran esi edu keteke domo eni amanfo wonu wose anate anate obrite chini tetite ya nananom amugi brempong nananom susu wadawase. Inga yeshie mu ahe nyina aka adomfo ya dia mre ya die nya seda apata akon ejekun abobo oprekese jana edu nananom amufuti krotia na muhunhwam eje fim ye nyina yenso yesi tawase wona ofra bo usanga ona maye ho usi habaye mu osiframa uhrusia usi wafefo merimetriso mo ahenewa mo enyado mo piafo mo nekasa yedase bebre. Colleagues, if you look at our program, the next is the keynote speech. And the innovation in there is that we're not going to have the keynote speech, because if you consider the speeches that have been given so far, that from our chairman, that from our convener, and the icing on the cake by our patron, we don't need a keynote speech. Everything put together is the keynote. So we won't have a keynote speech. We'll have the keynote speech already. So I'll move on straight to invite our guest of honor, who is the Honorable Minister for Health, to give his speech, and he is ably represented by the Director of Pharmaceutical Services, Pharmacist Joycelyn Aziz. And before he speaks, I would like to recognize the presence of Pharmacist Frank Boateng, former President of the Pharmaceutical Society of Ghana. So Boateng.
Thank you very much, Kobna, and good morning, all. As Kobna kept on, doing the accolades, I just said to myself, I wish I could do same. And I'll tell you a small story why I'm saying that. Our patron sitting here, he might not remember this, but he saved the life of my son. Yes, I was in the office one afternoon when I had a call, and they said, your son cannot walk. My heart missed a bit. So I couldn't drive. I called the transport manager. I said, can I get a driver? They said, yes. So they gave me a driver. I said, speed. I'm normally a very slow, gentle person. I said, speed, Papa ni, speed. So we got to Presec, and indeed, my son could not walk. He was in first year. So the first thing that came to my mind was, what do? I quickly called my colleagues in Kolebu. And then Madam Amankasa said, Jocelyn, you are very lucky. There is a team called Focus, and they are here to do operations free of charge. And these surgeries are aimed at such cases. And I said, thank you, Lord. Because immediately I saw my son, I called a few doctors, and he said, this kind of thing, you have to go to the US. So I quickly Googled, and when I looked at it, $200,000 was how much I needed. A poor civil servant. How was I going to do that? Fast forward, everything was done. I went to Micklin to see him. He was very affable. And talking about teamwork, Farm Abraham JC, you couldn't have chosen any other better person to talk to us today about teamwork. One thing that struck me was the team that he had brought from the US. It was in Micklin, very close to the Micklin Hotel. I remember very vividly. and they interacted with me. In fact, I have had opportunity to access health in the US before. So they mimicked exactly what I had seen. They had a chat with me. It was team. Everybody had a role to play. And I was like, wow. A round of applause to our patron. Long story short, as if that was not enough, the day of surgery came, some other person was supposed to. He saw my son, he said, I'm going to do this myself. He didn't know me from Adam. He said, I'll take this myself. And he did it. Fast forward, my son is fine. He's an IT consultant now. Thank you, Nana. So I am a very private person. I hardly share my personal experiences. Why am I doing this? Teamwork indeed makes the dream work. And in unity lies our strength. One person decided that he cannot do it alone. He went to extremes to ensure that he gathers together a team that can do the job. I remember it, you might also not remember this, Nana. I was the lady at procurement unit that used to facilitate the clearance of all your equipment, yes. Little did I know that I would even benefit from yours. So teamwork indeed makes the dream work. Teamwork makes the dream work. Thank you very much. I just want to say something small to Farm Abraham Jesse. I've known him for years. He's one person that inspires me. He never stops to amaze me. Last night I called him and I said to him, how do you get your energy? He said, Jocelyn, is the grace of God. Then I asked him, who is funding this? He said, I'm trying to do this alone. So after speaking with him, I lay in bed for about 20 minutes. I was just thinking, who is going to take after the likes of, I didn't know you were the patron, but as I sat by Prof. Akosa and Nana, I began to think about what I was thinking about last night. And I said, who is going to take after Prof. Farm Abraham Jesse? Now I'm beginning to think, who is going to take after or continue, take up the mantle and continue the good work that Nana is doing, that Prof. Akosa. I also have a story with him. I worked with him very closely when he was the DG. So speaking here, standing here, I have mixed feelings, happy ones and sad ones. The happy ones I've told you, but the sad one is that, and I'm speaking to the youth, who, the Bible says that who will go and who will I send? I'm speaking to the youth, who here among you are ready to take up the mantle. So much work has been done. We are not going to be here forever. I want to use this opportunity to inspire you to look up to the seniors and what they've done over the years and are continuing to do at their age. If you are not inspired today, I'm sorry, you're not going to be inspired anytime. Thank you very much. These are my personal, I'm here to perform a duty. And like Kwabena rightly said, almost everything has been said. So I'm just going to, I want to announce that I'm not doing this on my own behalf. I'm reading this speech on behalf of the Honorable Minister for Health, Honorable Kwekwa Jimamenu. He's had to go to Parliament, and so he's asked me to deliver this short but very important speech. So I'm putting off the cap of Dr. Mrs. Aziz, and I'm going to be your Minister for Health for the next few minutes. And so I read, Prof. Ajimambedu Akosa, Chairman of Forum 2023, Nana Prof. Ohiniba Boachie J. Uahine II, Patron of Forum 2023, special guests, eminent health professionals, captains of the healthcare industry, media reps, distinguished ladies and gentlemen gathered here in this auditorium, and all our virtual attendees, wherever you may be. I wish you all a very good morning. I am indeed highly honored by the invitation from Farm Abraham Jesse, CEO of Health and Development Consult, to be the special guest of honor for this first annual Health and Development Forum 2023 under the theme, Teamwork for Better Healthcare and Sustainable Development. I've also gladly noted that this Forum 2023 will be an annual affair, so we can all look forward to Forum 2024 and onwards to highlight and tackle other relevant health and development issues. I am told that the main objectives of this Forum 2023 include the following. 1, to engage the experts in conversations with their stakeholders and clients on the need for and how to achieve teamwork for better healthcare delivery and the achievement of the SDGs with special reference to health-related issues. The second objective is to follow up with 3 specialist roundtable meetings in May, June, and July of 2023 to concretize the necessary actions to be taken to teach, promote, and entrench the concept and practice of teamwork among healthcare professionals for better health delivery and sustainable development. 3, that's the third objective, the minister notes, is that this forum seeks to make recommendations for appropriate actions to be taken by policymakers, regulators, healthcare professionals, training institutions, clients, and stakeholders to ensure better healthcare delivery and sustainable development. To disseminate, the last but not the least objective, the minister notes that this forum seeks to disseminate such information and recommendations as widely as possible for the benefit of all in Ghana, Africa, and indeed globally. Nana Chair, these objectives are indeed remarkable ones and are very much aligned to the ministry's objective of achieving the universal health coverage. I have no doubt at all in my mind that this Forum 2023 and the 3 expert roundtable meetings that will follow will be successfully executed. Judging from the high caliber of resource persons, speakers, and panelists that are and will be involved, the Ministry of Health will eagerly await the receipt of the report of this Forum 2023 together with its recommendations. And I would like to assure you that they will be carefully studied and appropriate actions will be taken in the supreme interests of the good people of Ghana. Nana Chair, Prof Chair, the call for financial, technical, and logistical assistance to support the work of health and development consults has not fallen on deaf ears. We will engage to explore the ways and means to concretize this support. We also recommend to all the agencies and partners of the Ministry of Health to assist health and development consults as they may deem fit. Indeed, the Ministry of Health recognizes some of the good works that Health and Development Consult has been doing since it was founded by Farm Abraham Jesse in March 2015 to promote teamwork among healthcare professionals for better healthcare delivery as one of its main objectives. Finally, Nana Chair, I wish you all fruitful deliberations. May God bless our homeland, Ghana. Thank you very much. And at this point, I take off my hat as the Minister for Health. Thank you.
Thank you so much, Madam. We've had some really good conversations so far. At this point, we'd like to take a short 10-minute break. If you need, a bio break, maybe have some tea, some water, whatever it is you may need, and then we'll convene again in 10 minutes. Thank you.
The king of the Asante Kingdom, Otumfuo Tutu II, on his ascension to the golden stool as the 16th occupant, established a social intervention outfit, the Otumfuo Education Fund, in 1999. The foundation over the years birthed several other initiatives such as the Sewa Ampem Foundation for Children and Otumfuo Osei-Tutu II Charity Foundation. All this metamorphosed into Otumfuo Osei-Tutu II Foundation, with the king and his wife being the patrons. The Otumfuo Osei-Tutu II Foundation operates under 4 key thematic areas, ranging from education, health, water and sanitation, culture and heritage, and entrepreneurship as well. Projects and programs have been undertaken under the health thematic area in the past and present years. COVID-19 project. The foundation introduced a project dubbed Trade Safe, Stay Alive campaign to mitigate the spread of COVID-19 in markets situated in various communities within Greater Kumasi. Patience at CAT. Her Royal Highness Lady Julia Osei-Tutu on May 15, 2022, in commemoration of the International Day of Families, directed the foundation to settle the medical bills of mothers who have been on admission and unable to pay their bills. Breast Cancer Awareness Month. The foundation, through the direction of Her Royal Highness Lady Julia Osei-Tutu, has been undertaking free breast cancer screening for women annually in October. The annual project is titled Asanteman Breast Cancer Awareness. Donation of motorcycles. The Otumfuo Osei-Tutu II Foundation in November 2021 donated 10 motorcycles to 10 CHIP compounds in underserved rural communities. Vodafone Ghana Foundation, in partnership with Otumfuo Osei-Tutu II Foundation, organized a free health screening program for the people in Otafo Municipality at Otafo Government Hospital in June 2022. Over 3,000 people benefited from the day's program, which climaxed later in the day with a mini derby of chiefs, staff of the hospital, and workers of the foundation. The foundation, over the years, has provided and supported various forms of infrastructure to help improve health delivery in Asanteman and Ghana in general. The foundation is currently putting up a 30-bed maternity block for Menchia Government Hospital in Kumasi. The project is over 70% complete. Dental Outreach Project. The Otumfuo Osei-Tutu II Foundation, in partnership with Smiles for Everyone Foundation, initiated a project called Otumfuo Smiles Dental Outreach Program. This project involves providing dental and oral services and education to pupils and students in hard-to-reach communities. The dental services provided for these school children are cleaning, polishing, and extraction of tooth. This project is still ongoing. The king of the Asante Kingdom, Otumfuo Osei-Tutu II, on his ascension to the golden stool as the 16th occupant, established a social intervention outfit, the Otumfuo Education Fund, in 1999. The foundation, over the years, birthed several other initiatives such as the Sewa Ampem Foundation for Children and Otumfuo Osei-Tutu II Charity Foundation. All this metamorphosed into Otumfuo Osei-Tutu II Foundation, with the king and his wife being the patrons. The Otumfuo Osei-Tutu II Foundation operates under 4 key thematic areas, ranging from education, health, water and sanitation, culture and heritage, and entrepreneurship as well. Projects and programs have been undertaken under the health thematic area in the past and present years. COVID-19 project. The foundation introduced a project dubbed Trade Safe, Stay Alive campaign to mitigate the spread of COVID-19 in markets situated in various communities within Greater Kumasi. Patience at CAT. Her Royal Highness Lady Julia Osei-Tutu on May 15, 2022, in commemoration of the International Day of Families, directed the foundation to settle the medical bills of mothers who have been on admission and unable to pay their bills. Breast Cancer Awareness Month. The foundation, through the direction of Her Royal Highness Lady Julia Osei-Tutu, has been undertaking free breast cancer screening for women annually in October. The annual project is titled Asanteman Breast Cancer Awareness. Donation of motorcycles. The Otumfuo Osei-Tutu II Foundation in November 2021 donated 10 motorcycles to 10 CHIP compounds in underserved rural communities. Vodafone Ghana Foundation, in partnership with Otumfuo Osei-Tutu II Foundation, organized a free health screening program for the people in Otafo Municipality at Otafo Government Hospital in June 2022. Over 3,000 people benefited from the day's program, which climaxed later in the day with a mini derby of chiefs, staff of the hospital, and workers of the foundation. The foundation, over the years, has provided and supported various forms of infrastructure to help improve health delivery in Asanteman and Ghana in general. The foundation is currently putting up a 30-bed maternity block for Menchia Government Hospital in Kumasi. The project is over 70% complete. Dental Outreach Project. The Otumfuo Osei-Tutu II Foundation, in partnership with Smiles for Everyone Foundation, initiated a project called Otumfuo Smiles Dental Outreach Program. This project involves providing dental and oral services and education to pupils and students in hard-to-reach communities. The dental services provided for these school children are cleaning, polishing, and extraction of tooth. This project is still ongoing.
The Focus Orthopedic Hospital is the premier orthopedic institute in Ghana and West Africa. Over the past decade, and with the help of philanthropic donors such as Georgina and former Mayor of New York City, Michael Bloomberg, Focus has made significant infrastructural improvements while continuing to treat patients. This summer, we commissioned a 700-kilowatt solar panel with a 1 megawatt battery backup, making it the largest solar-powered hospital project in Africa. Our outpatient facility reviews over 6,000 patients annually from 53 countries and 6 continents. With the support of the Ghana National Petroleum Corporation and Mr. and Mrs. Wayne and Claire Hayland, we recently installed a state-of-the-art magnetic resonance imaging, better known as MRI, in our radiology suites. In addition, the Hospital for Special Surgery's donation of a 16-slice CT scanner enables us to obtain detailed imaging of the musculoskeletal system, including a 3D imaging of complex spine deformities. All operating rooms are fully equipped with modern orthopedic instruments and appliances, such as a cell saver system, surgical lights, and intraoperative spinal cord monitoring machines, also donated by the hospital for special surgery, which allows us to monitor the spinal cord function of patients during complex spine procedures. Intraoperative imaging with C-arms are also available when needed for orthopedic operations. In 2018, we opened the Wayne and Claire Halen Children's Pavilion, which is fully equipped with modern monitoring systems and orthopedic beds to efficiently manage patients. At the Kofi Annan Children Education Center within the Halen Pavilion, education is available for all local and international patients year-round. We implement on-site comprehensive educational classes led by our in-house full-time teacher. We're able to provide our dedicated hospital staff with convenient shuttle transportation to and from the hospital, thanks to the donations of Savavi Motors Company. The Focus Board, staff members, and patients would like to thank our donors for their generous support. You continuously help us help people stand tall. For more information about Focus and ways to support, visit focushospital.org.
Welcome back to the second part of the program. Before we proceed, we have a goodwill message that I'd just like to share with you. So one of the special invited guests that we had for the program wasn't able to make it, but he sent his kindest regard and sent a short message as well. So he's in the person of Dr. Anefia Samoaba, former Deputy Director General of the World Health Organization, a role that he held for many years. Prior to that, he served as an Assistant Director General in the He also has played many other roles in Ghana, even prior to and joining the WHO. Worked with the Ghana Health Service, National Health Insurance, and Regulatory Health Service, all of them. And his message is as follows. Chairman, Your Excellency, distinguished ladies and gentlemen, first, please accept my apologies for my inability to be with you. I wish to salute the organizers for the vision and foresight in putting this forum together. I wish to particularly applaud Mr. Ibrahim for his determination, persistence, and, if I'm allowed, stubbornness in ensuring that this forum on team healthcare delivery happens. The idea of a team approach to healthcare delivery is not new. Considerable progress has been made these last few decades, but a lot more remains to be done. We still battle with our historical and cultural baggage when for a long time, healthcare was equated with medicine. Medical care has traditionally evolved around the medical sector. In the process, other members of the team felt that their roles and contributions have been marginalized or not properly acknowledged. Recent developments in the world, particularly climate change and COVID-19, have once again reminded us how important that we work as a team to grow as a team. Healthcare delivery is support, and it's important to learn from other support, particularly football, and thinking of the Ghana Black Stars. We need all members of the team to play their part to have a winning team. It helps to have a team star, and it also needs other members of the team to help the star stand. To be a winning team, we need to have the same goals and targets. We need to strategize together, train together, and rehearse together. We need to understand and appreciate each other's unique perspectives, skills, and competencies. And we must cover each other's backs. That's why conferences like these that bring our different tribes together are so useful. Given the galaxy of stars attending this forum, I have no doubt that you will have a successful conference. I wish you all the best. Thank you. Okay. So now we'll move essentially is the crux of the meeting that we're having here today. We'll be having a panel discussion, but I would like to invite the moderator for the session, Dr. Mrs. Martha Jansa-Lutrot, former Director, Technical Coordinator, Ministry of Health, to take over. Thank you.
I think I have one here already. Thank you very much. I think I would like to stand on existing protocols. The professor himself who is chairing this discussion, and Nana Wadaroma, and the convener, and all other protocols observed. It will be my pleasure to moderate this section, which is for us to appreciate and digest properly what Nana has shared with us. Unfortunately, I guess some of the panelists arrived a bit late, but it's a small price you pay for coming in late. But nevertheless, we'll have a good time discussing the issue. For me, to help me do the discussion, we are taking the issues from a doctor's perspective, and to represent the doctors at this forum is no other than Dr. Justice Youngson. If he's in the room, can you join me up here? Not yet in, okay. And then we will take from the pharmacist perspective. No, you are the chair, so I will save you that. From the pharmacist perspective, we have the vice president, who happens to be the co-MC for this section, in the person of Mr. Kwabena Santiofe, who is also a lawyer. Mr. Kwabena Santiofe. From the nurse and midwife perspective, it's no other than my president, Mrs. Perpetual Ofori Ampofo. Please give her a hand. I enjoyed a lot of camaraderie from them during the COVID. It's we have to work together. That is what it is. We want to take it from the training institution perspective, and to help us do that is the rector of the Ghana College of Pharmacists, Dr. Yvonne Yerentua Eseku. From the Ghana Health Service perspective, we have Dr. Lawrence. No, Dr. Lawrence, my friend. Please keep clapping for him. And he is representing the Director General of the Ghana Health Service. And ladies and gentlemen, of late, and not of late, for 3 years now, we know what COVID had done to us and the place of One Health. And to balance this discussion, we have specifically invited somebody from Animal Health to come and share their perspectives. Please help me welcome Dr. Kikimoto. Thank you very much, Dr. Kikimoto, for accepting this habit short notice. I still wish I had Dr. Yankson. I think he's on his way. I can see somebody trying to, he's just around the registration, so he will join us. So ladies and gentlemen, these are our discussants. Give them a hand of applause. I would, yes. I believe that most of you heard all that the Nana has shared with us. He virtually shared his life with us. And it's obvious you are taking it from your own perspectives regarding teamwork. What things can we do better? And what things can be improved? Because not too long ago, somewhere in Ashanti region, something happened when the teams failed us miserably. And who are you? I am this, I am that. It couldn't have come to that. It just means that the teams were not working. So, ladies and gentlemen, I will take it, I will give you a breather, Dr. Justice Yankson, so that I'll take it from the perspective of the Ghana Health Service as to your thinking regarding all that you heard this morning. What is the services perspective on that? And as you speak, I want you to speak on behalf of service providers. Thank you very much.
Thank you, Mom. And thank you. My experience in the field, having worked at the emergency for a couple of years, taught me quite a number of lessons. So one day, for example, a patient who went to the washroom, very anemic and unwell, whilst in the washroom had a seizure and fainted and broke the toilet bowl and just fell there. So the question now is, who will lift this woman from the washroom? I will not have that strength. But there's a security man who is bulky and doing very well. So quickly we called the security man. And then he went in there with all the mess in quotes, lifted the security the woman and placed the woman on the bed. And then quickly I recognized that everybody in the team matters. When it comes to service delivery, even the driver is key for success when it comes to service delivery. So from the perspective of the Ghana Health Service, in a non-discriminatory manner, we acknowledge the role that every single person plays. There are times when you have to do CPR, the nurse is tired, the doctor is tired, but there are other people, even patient relatives who may be sitting there, down there. You call them, gentlemen, can you assist? You show, and then immediately compressions is going on, and lives are saved. So I would say that from the service perspective, we acknowledge seriously teamwork and the impact of teamwork on the outcomes of the services that we deliver. Thank you.
Thank you very much. I believe that most of us here have gone through the service, and so at this moment, we want to see where the gaps are, and so that we can recommend something that we could do together. And so I'll come back to you as you think through the gaps. And I'll go back to my friend, Dr. Youngson. From the doctor's perspective, what should we do regarding teamwork? Unfortunately, you missed a powerful lecture from Nana Prof, and it was very comprehensive. From the human resource to financing to infrastructure and to the processes. And we know teamwork, sometimes we play it down. And he made us aware that for a single operation, you need about 37 professionals to be able to do that. They all cannot be doctors. What do you think about teamwork?
Okay. Good morning, Auntie Martha and everybody. I think from the doctor's perspective, we have always held the view that healthcare delivery is premised on teamwork. Whatever the doctor does will also involve another health professional or one way or the other. It might also involve non-health professionals or other health workers. So the principle that teamwork is key in all that we do is very important. You can have a situation where a doctor could spend, say, 10 hours performing a surgery. If the other healthcare professionals do not play their roles well post the surgery at the recovery phase, say at the recovery ward or the ICU or wherever the patient finds he or herself, you realize that all the work that would have been done over that 10-hour period, inclusive of whatever preparatory activities would have been done prior to the surgery, will all be lost, and ultimately would have also lost a life that we all hope that with our interventions we're going to save. So teamwork is key. And I think that what we need to do is to improve on all aspects of ensuring that all actors know their role well. Teamwork will be there, but if the actors within do not understand their roles properly, understand when they need to come in, when they need to call on others, and how quickly people will respond to such calls, then that teamwork, even though we seem to be practicing it, it's actually not going to yield the results that we all desire. The key thing is that, at least if I look at my practice, over the years, I can say that for a lot of our facilities, there are some levels of non-functionality when it comes to aspects of the teamwork.
I think I will hold it there so that we will come back to what is not working well, so that we will proffer recommendations. With that, I come to my president. We say nurses and midwives, but it is when we are working with them that you realize that there are categories of nurses. And incidentally, Madam, the very experienced and the very ones that we needed. In fact, during the COVID, that was when we knew that we needed critical care nurses. Unfortunately, you are exporting them. And it will be good for us to situate, because when Nana was talking, Nana was made us aware that the human resources are very key in doing the things that we are doing. So can you speak to the gaps and also see how your teams as the sector, from the community health nurse up to the specialist nurse, whether it's an ENT nurse or whoever, can you speak to the gaps and what we can do differently? Whether we should continue to export as well.
So, what can I say? But thank you for the opportunity and giving me those pointers. Afternoon now, or it's still morning. Good morning, everyone. Good morning. And hello to the other panelists here. So, nursing and midwifery, as we know, or when we take nurses and midwives, they form the core of the health system. No health system can hold if it doesn't have nurses and midwives. Just like we have heard Nana speak and Prof. Chair speak today. If you take a doctor, for any activity or function of that doctor, you need a certain number of nurses to aid in that procedure. And nursing and midwifery has also come very far in terms of history. We are at a point in history where, from all indications, nursing and midwifery are independent professions. And we have individuals who go through the profession from the least grade to professorship. And so there are independent decisions that nurses and midwives take in terms of the care of the patient. Today in Ghana, we have three main forms of entry into the health system for nurses and midwives. We have the auxiliary, we have diploma, and then we have the degree. And when it comes to auxiliary trained nurses, although they are making an impact in terms of filling in the gaps where the professional nurse who is a diploma or a degree nurse is not available to work, science has always shown, empirical evidence available shows that the patient is safest in the care of a nurse or a midwife who has attained higher knowledge of skills and other competencies. So it is important that we actually look at our education. We are happy we have the Ghana College of Nurses and Midwives, and we are churning out specialists in various fields. We've always had in existence the post-basic specialist programs like the ENT, perioperative critical care. And just like you said, during the COVID-19 pandemic, the need for critical care and emergency nurses was at the top. And we had to even fall to the schools to give us those who were in training and had not gone far. So if you ask about the gaps, indeed, we need to beef up the professionals, be it the diploma holders, the degree holders, those having key specialties that are needed in the health system. But of course, when it comes to we ourselves as nurses and midwives, we are looking at a near future where the entry into nursing itself should be in terms of degree, because you are taking care of a human being, a complex human being from the head to toe. And you need every competency you need to take care, so that if you have to take critical decisions right there on your feet, it should be one that will save life, and it should be one that will make the condition of the patient better than what he or she came in with. And we know the emergency systems that we have in Ghana. It is absolutely not the best. And you and I can fall here, we can be rushed to any facility. But the question you ask yourself, whose hands are you going to be in? But in terms of teamwork, we appreciate that every team, and especially the health team, is composed of many individuals with many expertise. And every one of them, just like Nana said, if you take the body, the head needs the legs needs the hands, and the internal organs and all of it. And we need each other. And therefore, there are certain elements that has to go along if indeed we need to have strengthening teamwork. I don't know whether if you give me the chance or maybe later I'll talk about that.
I'll come back.
Okay.
I'll
Thank
come back
you.
to you, President Perpetual. I would now want to speak to Vice President of the Pharmaceutical Society of Ghana. What do you think is not working too well in terms of what Nana shared with us? In terms of the team, you see, he says something that really hit me. He says he was able to attract other professionals to his focus team. How did he do it? It means that teamwork can be very infectious. When somebody is seeing that you are doing it well, then they want to be part of what you are doing. In your own words, what should be the role of the pharmacist in this whole gamut of teamwork business? Are you working as a team, or you are following your passion and you are doing your own thing? Or please talk to us.
Thank you, Madam. Maybe I'll take it from a different perspective, slightly different. I think that whether or not we are working together as a team at any point in time should be determined from the perspective of the patients we are dealing with. I don't think that the patient who is looking up to us for healthcare cares whether this is your specialty or that is your specialty. What the patient cares about is that I can get well, right? So at any point in time, if we look at our roles from that, have we done all that we all can do to be able to give healthcare to this patient? And even taking it a little bit further to our unique circumstances, the convener when he was speaking, he talked about the fact that this is where we are. This is our own space. I was looking at this is important. This has come to mind because I was looking at some information a couple of weeks ago about NCDs. And I think you talked about NCDs. And on the WHO website, it says that 41 million people die each year from NCDs, 41 million. That Ghana's population is about 30-something million. So it's like every year, Ghana, the entire population just goes away. Then next year, it goes to another country. But what is interesting is that it says that 77% of those deaths occur in low resource settings, which is like Ghana is one of such countries. So when we think about our work with this in mind, then we realize that the work is really beyond just what as an individual I can do, but what we can all do together to prevent these things from occurring. I'll give you an example. And maybe I'll wear my lawyer hat a little bit. I was talking to a group of pharmacists recently.
I don't want the other lawyer to put it to you, please. So we want to have a healthcare conversation. Thank you very much.
So I was talking to a group of pharmacy students about negligence, legal negligence. And I was telling them how you have to make sure that you do what you have to do and do it right. And they asked me a question, and I said that so long as you've done what you have to do and there's evidence of it, you are absolved of your duty the duties upon you. Then somebody told me a story that apparently in a certain hospital, which is not a certain setting, which is not in Ghana, a doctor prescribed, a prescriber prescribed methotrexate for a patient to be taking daily. Apparently the dosage should be taken once a week. So the pharmacists drew the doctor's attention to this. And the doctor said, yeah, I know that this is not proper, but there's something I'm trying to do. And that's why, so please go ahead. He said, are you sure? I'm going to record the sign against. He said, yes, I'm sure, I've done it. So I thought that the pharmacist had done all that he needed to do to discharge his duty. In the end, the patient died, and the matter was taken to court for negligence. The judge, according to the story, held that both the pharmacist and the doctor were negligent. Because, and I was thinking that no, but the pharmacist drew the attention of the doctor, did all that he could, but the doctor said, do it. So why is the liability not just on the doctor? In the reasoning of the judge, he said that at the end of the day, it is the patient's life that is important. The two of you had professional knowledge enough to be able to make a decision that will save their life. But whatever you did, in the end, the patient died. And so the liability in that, what we learned from that judgment is that it is not even enough to do what you alone have to do. But at the end of the day, have we all done what we have to do to make sure that the patient gets life? And that, I think, was a good opener for me. Thank you.
Exactly the point. I recall in my early, when I was a bit younger than now. I'm not saying it in reference to Professor Ajima Bedu Akosa because he retired long before me. There's something we call kusum. You remember those kusum? Why do we do kusum? Kusum is like the doctor has written a prescription. Everybody knew that that prescription was not going to go anywhere. Take, for instance, somebody with pneumonia or something, and they are still pumping crystalline penicillin, and there are newer products that could solve the problem. The doctor does not want to change, and so the other healthcare professionals agree among themselves, apart from the doctor, and try to ensure that something different is being given to the patient. It is a way of saving the patient, but it just means that the teams are not working. Because if the teams are working, we will have seen that the doctor will be amenable to the changes that had come, or it also depends on the approach. The other healthcare professionals, the approach, as if I know it all. So why are you coming? Why are you not agreeing to what I want to say? That brings me to training. I believe that I know you have Rectors Forum, and so you will speak for the rest of the rectors that are not here. What can we do differently regarding what you are hearing and what you heard today? Today, Nana raised the issue about the fact that they wanted implants and it has to come from the US. But we have professors, we have pharmacologists, we have drug development experts. The best are coming from Ghana. I know Pfizer, for instance, one of their development pharmacists is a Ghanaian. Mm-hmm. So why are we where we are? Training. What can you say to that?
Thank you very much, Madam.
Can the teams work in that area as well? Thank you.
Thank you so much. And thank you to the other panelists. I'm very happy to be able to contribute to this discussion. And Auntie Martha, just like you mentioned, we do have the Rectors Forum. And at the Rectors Forum, one of the things we discuss is how we can together build a health workforce that delivers specialist care. So from time to time, we have discussions on even the training, our engagement with the teaching hospitals, our engagement with the training sites, to see how together we can ensure that the specialists are trained in such a way that the contributions of each specialist is recognized to ensure improved patient outcomes. And to bring it back to, for instance, the Ghana College of Pharmacy specifically, we think that collaboration, teamwork is so important that this is one of our core values. And that's one of the things that we hope we can share with all our specialists when they have finished their training. We also, when you were speaking, you talked about the approach to which some communication may go. Indeed, for us, we ensure that communication, and so communication among team members, communication with peers, communication with superiors and subordinates, is one of the things that every person who goes through the Ghana College of Pharmacists has to go through and pass exams on that. Even though it is not a technical skill for the pharmacist, we recognize that it is very, very important. Because yes, the pharmacist, you are the expert on the medicine. You have given the information to the prescriber. But how did the information go? Was it such that it was challenging the prescriber's understanding of the condition? And then egos come in. Then egos come in. And once egos come in, people take entrenched positions, and we cannot make progress for the benefit of the patient. So and of course, inbuilt in teamwork is the understanding that there are various parts. As Nana mentioned, there are various parts of the whole that must work together in such a way that they appear as one. So just as has been mentioned, we have arms, we have legs. But when the human being is moving, we don't really say that the person's legs are moving. We say it is that person because that person has grown to utilize all their members in such a way that it is one unit. And in my mind, I think that that is the way we should be, that is the direction in which we should be going, so that the healthcare team is one. And the patient, just like Vice President mentioned, benefits without necessarily even identifying that I interacted with this particular professional or other, but rather that I went for healthcare and the healthcare team delivered.
Fantastic. You see, I raised the issue about implants, and I'm just wondering which of the professions are best placed to begin to look at production, local production in terms of drug development, because we are thinking about how we are bringing them all together. You recall that during the COVID, Justice, myself, and Korea Perpetua, we were there, especially when it has to do with vaccines. You have done all the things you have to do, but you don't have the vaccines to give to your people because we don't have it. We are not producing. We are vaccine consuming. So how, moving forward, these are all part of the team things we are talking about. What can we do differently that the story does not repeat itself? I'll be thinking about it as I come to the issue about One Health. COVID made us aware that really, if we didn't want to work in a team, you have to work in a team.
Yeah, thank you.
I'll come back to you.
Okay.
If you don't want to work with veterinarians, you must learn to work with them because of the zoonotic diseases and how they are affecting our lives. And I'm sure WHO has come up with this treaty that is supposed to look at all the issues, information sharing, although they want data from us, but when the products are ready, they don't want to share the products like that. You know what I mean? You share your data with us. But as for when we make the products, no. We have to look through the patent law and see whether you qualified under the TRIPS, whatever before. So, Dr. Kikimoto, you are a veterinarian. Yes. What do you see about teamwork and how it applies to us in Ghana, especially with the inside that where we are now as a people?
Yeah, thank you, Madam Mata, and all the people in the room. I'm very grateful. I was invited to participate in this One Health meeting, and I thank H&D Consults for all these efforts put since 2015 to reach this level. As a veterinary doctor, I'm here to represent the veterinary profession. And I'm a veterinary public health specialist consultant. And when I used to talk to Dr. Jansen and co, they say, what is veterinary public health? And I said that veterinary public health is the sum total contribution to the physical, mental, and social well-being of human beings through the application of veterinary medicine. And the environment, animal health, and human health are inextricably linked. That is why globally, there are over 4,198 diseases in the world. Out of that number, 3,558 are of animal origin. Only 630 diseases are purely human diseases. And that is why One Health is very, very important, and I'm happy to be here. I'll let you know that most of the diseases that we get now, which are actually becoming pandemic, are of animal origin. Be it Ebola, be it COVID, you know, all those diseases that you remember. I remember when we were young, we used to have something called measles, mumps. All these are diseases from the bat. The bat has about 55 diseases, out of which only 12 of them have been actually analyzed with phylogenetic trees. And that is why my presence is very important. I just want to make this one known that we are working as one, but sometimes we don't know. If the veterinary profession stands on its feet, the human sector will have some briefing space. But if the veterinary profession doesn't stand on its feet, that is where we have all the diseases. And once it moves from the animal into the human being, I'm telling you, it takes a different form because of the peculiarities of immunity, of coexistence, and everything. So my presence here is very important. That is just for the introduction anyway. Now to come to your side. I have since 1995.
You have 2 minutes.
Yes, since 1995 been working with Minister of Health. When Dr. Sambugri was in charge at Kolebu, I used to go to him, give him diseases from the rabies and other things. But people in the health sector just know the rabies, anthrax, TB, brucellosis, all this. But there are a lot of diseases from Akantia, 55, from chicken, 35, from this, plenty. But we don't care. And we go eat and we die, we don't even know. So I'm very happy that today we are here to work on collaboration. And I'm here, the pharmacists also know that when it comes to antimicrobial resistance, it is something very important for the animal sector too. So we are here together as one, and from now onwards, let's improve the way we collaborate. You saw it in COVID, you said Ebola, when we formed the National Technical Coordinating Committee for Ebola. I was even chairing the ministerial meeting because the minister will say, Dr. Kikimuto, sit down and chair for me, and he will leave. Thank you very much for giving this opportunity. Thank you.
Thank you. Thank you very much. We understand that we are not in the room alone. People are participating virtually. And so, Rafik, you are going to work with me to let me know whether there are questions online. And then we'll be coming back to the audience if they have questions for my panelists. I'll go back to them one more time to let me know exactly if we are living here today, what should be that one point you want to go back to your teams and say that we're as nurses, as midwives, this is what we want to do to improve on teamwork, to ensure that the teams are working. I'll come to each one of you, and then you give me that background, that answer, together with the other ones that I say you should hold it. So you bring them all up. I will start from Dr. Jansen.
Thank you, Auntie Martha. I think that the mere mention of teamwork in itself does not resolve the core details.
Yeah.
And once we all acknowledge that teamwork ultimately will lead to better outcomes, then we, of necessity, have to look at the key activities and the supporting acts that will help ensure that there's real meaning to teamwork, but not just, the rhetoric. Now, for example, teamwork, if you look at scenarios and situations and health setups where it's properly working, you of necessity will have to have procedures and protocols in place. So some of the key things that we need to ensure that we have in our setup will include these two. Beyond that, effective communication and collaboration, very key. When communication goes wrong, I tell you what, teamwork will break down. And when there is no communication, then there is no teamwork. There's an example here of negligence. If the team works properly, there's a propensity to reduce medical errors, improve patient safety, and outcomes. So until we go to the fundamentals and ensure that the soft factors, as I will call them, beyond the technical knowledge, are properly worked on such that the team works as a complete unit with all areas that ought to be greased, oiled, done properly through the use of manuals, protocols, and stuff like that, we will not get far if we just keep mentioning teamwork, teamwork, teamwork. Traditionally, you realize that doctors, let's say for the bigger hospitals, Kolebu, for example, we always will work in teams. I may be on the surgical block with my set of doctors. We'll have our in-house meetings, we'll have our departmental meetings. But beyond that, we also will go to Professor Akosa, who is the doctor's doctor. So when we are managing a patient, and the communication between pathology, as in his department, and the surgical block is broken, the teamwork is not going to work. Because sometimes we even need quick results. And we'll have to call on him to stop all that he's doing to make sure that we get the results within the shortest possible time. If he's not in the know that we are looking for this urgently, he might be doing other things. Meanwhile, we also need the results to work on the patient. So effective communication, collaboration is very important. And there are times that he will ask me, bring the patient's folder to my lab, and we'll sit down, we'll discuss the patient, and he will go back to the slides and look at certain things and advise us properly. So there are mechanisms that ought to work properly. Sometimes basic things like communication gadgets are lacking. You see, we should understand that if we want to get all the things right, the setup also has to be right. And in some situations, you go to the health facilities and you don't even have, say, a number to call even one department or reach out to a specialist. All these little things will not ensure proper teamwork. There could be harmony, as in I see my colleague, we are on good terms, I greet her, she greets me and all that. But when it really matters, if we haven't addressed some of these little stuff, we realize that the functionality becomes a problem.
Challenging. Yeah.
I mean, everybody talks about patient safety. What is more important than ensuring that the patient is safe? But sometimes the environment itself creates problems. Sometimes even at the lowest level, respectfully, you don't even know who does what and who is in charge of what.
And so that brings us to the issue you raised about protocols and procedures, that if we don't have them, then it should be available. Do nurses have protocols and procedures and standard operating procedures? I respect.
Yeah, I'm going to give it to you, but let me just conclude. You see, I give the example of the just a quick one. I give the example of the doctors meeting and all that.
Yeah.
Even beyond that, even at the ward or the floor or department level, there are times we need to have meetings between doctors, nurses, and all other healthcare professionals to ensure that a particular patient's care is in the direction that we all want it to go. So it is not only about the sub-unit meetings, but the collective is also important.
Very much so. Thank you very much. Yes, Mrs. Perpetua, Opere Ampofo.
Thank you very much, Auntie Martha. So this is what I have to say. The issue of training of professionals is key. Placement is key. Preparing the right job criteria, protocols of scheme of service, everything is key. The work environment is also key. Other systems, like systems of reporting and all those things, are key. The economy, the bigger picture, is key in terms of developing whatever communities that health professionals are and delivering service. It's also important. When it comes to teamwork, let me not mince words here. The truth is that, you know, the Menchia case.
I didn't want to, because we are online, I didn't want to go there.
Yes, but you
although I
mentioned it. Yes, but I'm not going to go into detail. But the truth of the matter is, that was all that we were calling for, that institutions should put a little investment into educating their staff about team building and teamwork. And it was interesting that when we had the opportunity to speak to the nurses at Menchia, all of them seated there, I asked a simple question. How many of you have had the opportunity to go through any workshop or training related to teamwork or team building? There was only one hand that was up. And that one hand was the hand of the DDNS of the facility. So they are working, but they don't have any knowledge about what, because in training you are taught there is a health team, there's a medical team, it involves this and that, everybody has this role to play and all of that. But the practicality of being at the work setting and having to work with people with different personalities, they come up with different attitudes. You have patients who are also coming with different sets of personalities. It takes a lot to understand, to be able to work with everybody. And we need to recognize and respect each other in our teams. Yeah. We need to recognize the role each individual plays in the team and respect that. We need to understand that we are there primarily for the sake of the patient, to ensure that that patient gets better and goes home to his or her family. It's very important, so that we throw away the egos and the I'm better than you, I'm higher in terms of my education. And people don't say these things with their lips, but their attitude alone tells you what it is that they are looking at. And when it comes to the care that we give to our patients, I think we should be humble enough. No individual has every knowledge in his or her head. You may fall short in one way or that you may not even know. And it's important that you are humble enough to take the advice. A nurse can advise a doctor. I think with my many years of experience here, I think this one, if you do it this way or do it that way, it can be helpful. And I tell you, the best doctors are the ones who learn from their nurses. Because you come in at a very young position as a house officer, now learning. And there are so many things that you wouldn't have gotten the experience in school. Yeah. So it's all important, and we need to encapsulate all of this in the way we go about our duties.
Exactly, Mrs. Ampofu. I think that we all owe our subordinates. I learned from my technicians how to prepare, what we call it, Dettol. Because honestly, at a point, anyway, I'm a pharmacist, so. He taught me, because the one I was doing at school, small, but this is one they gave you a whole barrel to do. And so it is important that we respect each other, but we must also remember that there is a team lead for all this. So the balance must be there for all of us. I come to the pharmacist. I know you have a standard operating procedures, but how far is it being implemented? The vice president of the Pharmaceutical Society.
Thank you. I always vary your question. I apologize. I said my own question and answer it. Forgive me. Forgive me, because I'm going to do that again. And I want to take that from where Doc GMA was speaking, talking about defined roles. And I think the place to start from one of the places to start from is the current Health Professions Regulatory Bodies Act, which clearly defines from a regulatory point of view, what everybody should be doing. And I also want to share that I know that there are discussions currently ongoing among the health professional groups to take a critical look at that piece of legislation to see whether it is fit for purpose and to make suggestions on how it can be improved to ensure that there is better harmony, coordination, and people know what they are doing, especially for the benefit of the patient. The second thing is just a thought I want to share is that, you know, the knowledge and competencies of the various professions are advancing. Now, for example, the minimum qualification for being a pharmacist is the PharmD degree. PharmD is obviously better in terms of the content and competence that it produces than the original B Pharm. So should a PharmD graduate come into the field to do the same things that the B Pharm person was doing, is there something else that that person can do to make the work of another healthcare professional a little bit easier? And that healthcare professional, as they also advance in their competencies, is there something else they can also delegate so that other people can do, so that we are not all doing the same traditional things we are doing, although our competencies have gone, you know, up. There are some conditions, in my view, and this may be radical, that you don't have to go and queue and wait for a doctor to see and make a decision on. And I think that at this point in the level of competencies of other professionals, perhaps they could also do that so the doctor can attend to things that he only has the competence to be able to deal with. So I think that's something that we need to think about. The next thing, you asked a question about local manufacturing, for example, and I just want to share your thoughts on it. The idea of being competent to produce our own medicines is something that goes beyond everything. It is one of the things, if we are talking about real teamwork, then that's one area that teamwork comes in very significantly: economy, taxes, and everything. And I'll give you one example. So in the current policy around local manufacturing, there's an incentive that says that in the procurement of locally produced pharmaceuticals, the procurer should give, if it's government, should give a 15% price preference to the locally produced medicine, which means that if medicine A is 10 cedis locally produced, and then the quality, everything is the same, and then we have an importer, one importer that is 9 cedis, we should still prefer the 10 cedis one, although it's a little more expensive than the imported one, because we want to promote locally produced pharmaceuticals. Now then, a question came from the Ministry of Health that price preference that I'm giving, is it coming from my budget or is coming from the Ministry of Industry's budget? Because for the Ministry of Health, that money that is giving away could have been used to buy a lot more products to cater for a lot more people. So when you say that give a 15% price preference, who is paying for that 15%? So that's a policy that is there, is well intended, but cannot be executed because there isn't the harmony on that. So in the local manufacturing in a conversation, it calls for a multi-sector, multidisciplinary, multi-everything collaboration to be able to get us there so that the next pandemic that comes, we can actually have the vaccines to help our people.
Thank you for that. I think that I asked that question because the President of the Republic has set up a committee, and there's a legislation now on vaccine manufacturing. And it cannot be just about manufacturers. It has to be about the professions coming together to provide certain services, scientific services, legal services, and everything that has to ensure that Nana Professor will not be importing implants. That is to say, I'm not just, vaccines are different from implants. Mm-hmm. So I'm just citing it an example that what can we do, our generation, what can we do differently? Like, for instance, to support the president's move to ensure that we become vaccine producing. And that is why I was trying to link my question with the trainers as well as the Pharmaceutical Society. But I know also for sure that government has excluded or call it restricted certain medicines from importation. Why is government doing that? Just to give a leverage to the local manufacturer. But is government getting value for money for that? Yeah. Thank you very much.
Look, I'm not responding to that. Just a concluding point. So
Concluding.
my last point was
it
about
will be 1 minute.
1
please.
minute. At the moment, we have a lot of community pharmacies spread across the country. Almost everywhere you turn, you see a community pharmacy. And we've been thinking that how can the health sector, the public health sector especially, leverage the presence of community pharmacies across the country to help even advance care at the community level? I think there's a missing link between that. And I think it's a huge resource that we can leverage on to advance healthcare even further. Just wanted to make that point.
I think I agree with you. I will let the Ghana Health Service speak to that. Not speak to that. Speak. Talked about their own thing and try to answer that, because I know for sure for malaria, for instance, the community pharmacies are leveraged to provide that type of service. But how can, and of course, during COVID, we managed to get the private sector do the things we want them to do by creating the SOMAs whereby they can input their data. Can we do something similar to get the data from the community pharmacies? Because remember, they are the first point of call for many Ghanaians when they are not well.
Thank you, Mom. So one of the core values of the service is teamwork. And we saw that being displayed during COVID, where we brought both the private sector and government to provide service and delivery. Currently, there is a project that the service is undertaking on event-based surveillance, where we are looking at bringing all the chemical sellers and community pharmacists to be key stakeholders when it comes to surveillance and public health. And having said that, one of the fundamental things that the service is looking at is culture of individual people. We will have the SOPs, we'll have the training in the schools, but as individual people, if the culture is not there, the outcomes are going to be bad. How do we see ourselves? Are we there to provide service for the individual person, or we are there for our individual gains? So everything that the DG does is bringing people together. And my boss would always ask me, who are you bringing together? In public health, it's about science and it's about arts.
Yeah.
And Professor Irina Jipon taught us that there are things called soft skills. You may have the knowledge, you may have the know-how, but the question is, attitude-wise, do you see yourself as a team player? Are you ready to respect your subordinates? Are you ready to respect your superior? Are you ready to be part of the team? If you are not willing to be part of the team, everything that will be done will come to nothing. And Henry Ford of the automobile industry once said that coming together is just the beginning. Yeah. Remaining together brings some form of success, but working together gives you a bit more than what you are looking at. So from the service point of view, we want to ensure that people inculcate the culture of teamwork. You are not there alone. You are not there for yourself. So that at the end of the day, you are not going to malign someone so that you become the ward in charge, or you are going to paint somebody black so that you take a certain position. But you are there in the interest of the patient. And once that mindset is there, a lot of things, because you see, the doctor is tired, but that patient is having bleeding and is going to die. So the doctor will have to come to work. Whilst the doctor is working, the nurse is there also playing that key role. And your boss is also around to prove. And all these things come together so that we are able to save the situation. So teamwork for us is a key value that every health staff must possess. Thank you.
But how do you intend to collect and collate data from the smallest facilities, which I'm sure your deems to a database may not have every data on health of the people? That's the question that the Vice President was trying to ask, but I tried to turn it in a way that how can Ghana Health Service get data from the community pharmacists so that you can have a holistic database about what the people are treating, what the people are getting, because in doing that, you'll be able to detect, which is one pillar of surveillance.
So, quick one. And like Mom said, we are having the community network of practice, which has become the main thing now. And in the next few months, building on what the Family Health Division have started doing or did in the past, where information was gathered about all the chemical sellers and community pharmacists, we are upgrading it so that we have a repository of all the community pharmacists and chemical sellers. And then we develop early warning signs and signals. We train them, we bring them to the table, and we teach them about thresholds so that should you suspect that, oh, in this past week, we've had 7 young children coming in with some form of conjunctivitis. Could it be the beginning of a certain outbreak? Then they trigger a certain signal, the district director will come in and then escalate it to the next level. So there are plans to ensure that a certain system is developed at the community level to pick certain signals which can be translated into potential outbreaks so that the service can respond immediately to such things.
Exactly. Thank you very much. I would come back to Dr. Kikimoto before I come back to the rector. Whilst I offer the participation of all of us seated to ask your questions or to make contributions. Dr. Kikimoto.
Yes. Yes, Madam Mata.
Yes. Can you tell us what should be the take-home points for veterinarians working with women health to ensure that the teams are working well? I know that antimicrobial resistance provided us a base, but we have to go beyond that. There are outbreaks that are coming in that had come on, especially the last outbreak we had with the fowls. How can you work with the surveillance department of the Ghana Health Service to ensure that information flow from you to the database is well captured? And I know that it's not everything we are all getting right, but how can veterinary up their game to that effect?
Yeah, thank you very much, Madam Chair. I think that...
yeah, I'm a moderator.
Yeah, I'm a moderator here. Yes, it's true. You know, veterinary services, I think that I wanted to use this opportunity, since this is your August house, let them understand a little bit about the veterinary aspect. That's why I went that a little bit deep. The second thing is that, you know, most of the people in the health sector, apart from people that I've come in close contact with, like the people on the platform here, I think all of them know me. The veterinary services consists also of a group of workers, but the final bus stop stops with the doctor. The second group of people are the veterinary technologists. The technologists, no, that the veterinary nurse comes before the veterinary technologists. The veterinary nurses are BSc from the universities. Then the technologists are diploma. Then you have the technician that I just finished Pontamale. Then you have the community health, animal health worker. He is not very educated, but just thought the basic thing to do. And all these people work together to make sure that any disease outbreak at the lowest district or community reaches the epidemiology unit at the headquarters. And this, all those that are zoonotic in nature are captured and then forwarded on the One Health platform to the Minister of Health, so they know what is happening at the animal health sector. So there's a very great relationship in almost everything we do. We are not working in isolation. As I already told you, we have a National Technical Coordinating Committee, which is a One Health. It's environment, animal health, even immigration, interior, all of them are there to make sure that everything that we do, it is leaded, as I said, it's headed by Minister of Health. And we should not forget, even though they call it One Health, it's still like half health, because normally everything is organized by Minister of Health, and they invite me to come and sit down. How many times have you seen the animal health organize such a big thing, which is organized under the leadership of H&D Consult? And Nana Professor is also here. So we have to game this, we have to up our game so that this one actually works very well, because you have done very well with antimicrobial resistance. You brought up us to the same level. Even we have even overtaken some parts of Ministry of Health, because we have had problems with viral diseases, which you neglected long time. You left this one with Noguchi. Noguchi is just research to get professor. After that, what happens? Tell me, what happens? We were not doing that. We made sure if there's avian influenza, we diagnose it. We kill the bears. The fortunate thing is that you don't eat your patients, but some people eat them. So even they're happy, they are dying. So, the good thing is that there are certain diseases, if you eat them, you are also dying. Like anthrax, you die.
Thank you.
Thank you very much.
Thank you very much. When he was speaking, I just realized that rabies, for instance, once we are able to stop vaccinate the dogs, then it cannot get to the animal. It cannot get to the humans, because when it gets to humans, really, there's nothing that can be done. As best, they may give you anti-rabies, but if the dog or the animal is already rabid, then, I mean, hack my soul, it is the Lord. And so it is important that we work with the veterinarians. And for me, zero tolerance for rabies is one way we have to go, because getting anti-rabies is so expensive, but getting the rabies vaccine for the animals is cheap. So really, let the teams work. Let the teams work. Yes, Rector, your final words, and then we will come back to the audience. I will take 2 or 3. Please, your hand should be up before. Otherwise, once I take the 3, I will not accept anymore. I've been already warned that time is fast spent. Yes, Madam.
Thank you very much, Madam. I think one of the things was how we can build capacity and meet some of the gaps with respect to the production of devices, pharmaceuticals, vaccines, and all that. And to my mind, what I would take home with me as a trainer would be to try to put together a kind of training curriculum with, for instance, when we are talking about screws, for instance, we want to speak to the engineering faculty, to schools, for them to appreciate what is needed. And I believe that they have the technicians to produce these equipment or these devices, but it is a better understanding of what exactly is needed. And so if we are able to, now that we are expanding our focus of teamwork beyond the health team to everybody who contributes in some way to health, then we have to speak with them and see how we can better prepare these technical people to meet those needs that we need. These are products that we are already using. And so it's important that we can bring ourselves to the point where we can produce them so that they are used for our benefit. Then the freight, the transportation, bringing it from New York will be taken out. And that will bring the costs down.
Exactly.
And so the service will then be provided to more people than is available now.
Thank you. Thank you very much. I think that this is sending us somewhere. But before I bring the curtains down here, I will take your questions and your contributions. I will take 3, and I would like to take from all the 3 rows. But here it's already loaded. And so I would have the honor to the young man there in mask, and then the third from the back there. Thank you very much. Take it away.
I'm grateful, moderator. My name is Asamoah Sari from the Port Health Department of Kutka International Airport, with a background in global health security.
Please,
I was so much.
We want to hear him. So.
Oh, sorry. I think I'm loud enough.
Because there's some background noise
Thank you.
at my end.
Yes, from the presentation from Nana, he touched on the Global Health Security Index with Ghana's position not so attractive. Yeah. Out of 195 countries, Ghana was even below the 100 position. Yeah. And one key factor has to do with the antimicrobial resistance. If you go into the Joint External Evaluation of 2017 for Ghana's report, AMR, the highest score is about 2, which is still not good red. So now, with us having a lot of pharmacists among us, what are we doing as pharmacists and the council to contain the situation where less potent drugs cross our land crossing points and unapproved routes into the country? Because advantage is that Ghana is doing well with the pharmacist and then the over-the-counter medication points by writing the time of the medication on the pack, which is now very good and commendable. In country level, we are doing our best as pharmacists or the council, but across the borders, do we have the capacity in terms of surveillance to ensure that substandard drugs in terms of antibiotics are not crossing into the country, so that if you take the 7-day dose, you are sure you've gotten the maximum milligram that has to go into your system to fight that infectious agent? Thank you.
Okay, thank you very much. We will take all the 3 at the same time and try to proper answers. And please take note of the questions. If you need my assistance, I can help small, but not completely. Yes. The next one, please. Yes.
Hi, everyone. My name is Luca, and I'm a pharmacy student from Entrance University. And I would just like to speak about training. When we're talking about training, I think there is something important that I realize also as a pharmacy student. I'm in 4th year. I've done hospital internship already, factory, and also I've gone to the community several times. In our training, we are supposed to do at least 120 hours in each of these sectors currently. And when we get to 5th year and 6th year, we go to the hospital more frequently. But I still feel like when it comes to the hospital side, the clinical part of pharmacy, which is very important here, we get to interact a lot with the other health professionals, and it can give us more idea of how teamwork should be done in the hospital before we become pharmacists. But for the other parts of it, like drug development and procurement as well, we don't get to interact as much with the other sectors for us to know much more about teamworking also with them to secure development and also the access of drug to everyone in the country. So my question or my suggestion is also that what can be done for us to have more knowledge or to be better trained to work better with the other sectors that are also involved in healthcare delivery.
Thank you very much. My attention has been drawn to the fact that I am not gender sensitive in terms of those who are asking the questions. And so there's a lady whose hand is up in this middle row. And secondly, because you are sitting behind the chair, I want to be fair and ask you to speak. You have the floor. In the row. Okay, yes, go ahead. Thank you very much.
Good afternoon.
And please, let the question be simple. But if it comes to square roots minus, it becomes challenging.
It was actually a contribution in relation to what he said. So as he said, we have the opportunity to go to the hospitals to have our clinical practice. But I feel it's also important that we also have a simulation, sort of a situation where all healthcare professionals have to solve an issue. So maybe a case study will be brought, and then either maybe the phlebotomist, the nurse, the technician, or the pharmacist will be present to show the importance of teamwork.
All right. Thank you very much. It's a contribution, I guess. The last question from the back.
Good afternoon, everyone. My name is Edwin Panford Kwenu. I'm a PhD student from the Liverpool School of Tropical Medicine. So this question actually is more towards the gentleman from the Ghana Health Service. You mentioned culture when you were talking about things that we could do. So my question to you, and obviously the rest of the panelists, is how do we leverage culture when it comes to teamwork? Because there are certain things that we know people will say, this is how we do it here, and will not be ready to even take on any innovative approach. So how do we leverage culture?
All right. Thank you very much. I come back to my panelists to respond to the issues. Who wants to? You want to
yes,
give a go?
I'll try.
Okay.
I'll attempt. The question on antimicrobial resistance, and I'm very happy that he observed that a lot of work is being done in the country, and I suppose that your point brings out the fact again of what Nana talked about how we should bring everybody on board. If we want to ensure that we control antimicrobial resistance, if we want to ensure that we improve antimicrobial stewardship, we can't only say that a few people who handle the medicines should do the work. But again, we should also make sure that that information that is coming from the people who are doing the work is well captured. So we should recognize that there are other people who are controlling, for instance, the borders. We should recognize that there are people who are testing to make sure that the medicines are of a certain quality. And we should recognize that there are people who are working to ensure that the patients are getting the right medicines, getting the right information. And when there is the need to identify the role of all of these people, we must do that. And considering teamwork, perhaps at some point in time, bring all these people to the table to discuss how we can improve on ensuring that we win this fight together. Thank you.
Thank you. Maybe to add just a bit to that, I'm sure you are aware our Food and Drugs Authority is very agile. They are regulatory maturity level 3, going on to 4. What I know they have done in the past is to set up a multi-sectorial committee, including immigration and the customs, so that together this can be fought appropriately. They are not here to speak, but the little I know about what they are doing is what I'll add to it. The next question, who is taking the next one? Yes, Mrs. Ampofu.
You were going to answer the last one, the culture thing. So organizational culture is usually influenced by the governance structure, the operation systems, and all other systems that are put in place. And therefore, it also has an impact on how people relate in terms of teamwork. But if you have policies or structures that are not benefiting or impacting positively on the care that is being given to the patient, it obviously needs to be reviewed. Needs to be reviewed and made better. So it's important that the leadership and management teams consistently or periodically review all those systems that are in place to ensure that whatever is being done at the end of the day is the outcome on the patient that we are looking at, and which has to be a positive one.
Thank you. Yes.
Thank you. Just to add to what she said, we are all aware that the service has a code of conduct that is supposed to streamline the attitudes of staff, especially regarding teamwork. Beyond that, there are departmental meetings that are held regularly. There are, hospital meetings that are held regularly at all the levels. And during such meetings, all the cadre of staff are brought around the table, they are peer reviewed, and feedback is given so that there's some form of improvement in service delivery. So we are very mindful of leveraging on culture and how it can impact. Just a quick one. Yesterday I was talking to a colleague where a patient had been referred to another district, and maybe the district will say, oh, we don't have a bed. And I was saying that if this facility was in your district, there's no way they will say that we do not have a bed. And we have this no bed syndrome, and most of the time it's just culture. So when the code of conduct and all the disciplinary measures and the governance structures are working well, the chances are that most of these unexpected or untoward issues will be dealt with. And consistent work and effort is being put in place to orient incoming staff, and then the continuous professional development on ethics that keeps going on. Thank you very much.
Thank you. Yes.
Madam, I want to.
There's a question on training.
Yes. I wanted to thank my colleague, the student pharmacist, for that contribution. My takeaway is that the suggestion is that the teamwork must even start from the level of training. And thank you, lady, for the suggestion that you gave, which can be built upon. I think it's a good one. So we'll take it back and then we'll work with the leadership of the training institutions to try and get it done.
I think it should not just be for the pharmacist training. It should be across board. I think the justice of these courts. So we expect the nursing and midwives to do the same with doctor, the same with laboratory scientists, and that type of thing. Carry on, please.
Yes, just to a quick takeaway for all of us. I think that for us to have real meaning to teamwork, we need to understand that there are two key things that probably we haven't touched on so much. We have mentioned them in passing. One is effective leadership at all levels. Without it, the team will be in chaos. For which reason, I think that the ministry itself, all the way down through the service level, i.e. Ghana Health Service, the teaching hospitals, through to the district community setups, it is something that we should take as part of the norms that we'll have to up, so that we know that we are giving real meaning to teamwork. Two, the teamwork is also not just about the hospital setting. It goes from the national all the way to the community level. And when teamwork works properly, you end up with better community outcomes. So we should look at it in that perspective, rather than just more or less trying to focus only within the hospital setting. The hospital setting is just a subset of the bigger arrangements. For me, these are two key things that we ought to know. But ultimately, the overall impact or outcome is what is most important. And that is the results that the patient or the community gets. Patient safety, proper health outcomes, proper rehabilitation, prolongation of life, and making, life generally better for our people. I think these are some of the things that we should not forget as we do this broader discussion. Thank you.
Thank you very much. That reminded me of Miles Munro's definition of leadership. It says that leadership is the cause, all others are effect. And so if we failed as leaders, it means that everything else has failed. I think that the caution is well noted. I recall, I just want to tell a small story. World Vision is implementing some projects in Kasina Nankana and a few other districts, and some in Ashanti as well. And there is no minister for trade, there's no minister for health, and there's no minister for agric. But the community have blended together. They are making their eggs, they are selling them, they are giving the eggs to their babies and their mothers, and blood levels are going up. That is all we need as a people. So the teams, it's not what happens here in this room. It is what happens in our communities, like you rightly said, that all these have come together to support the community to live their lives and be economically viable and be economically independent and be able to look after their children and their communities. Any other comment? Yes, the Minister for Health, how can I say?
If I heard you well, one of them mentioned the issue of a gap in your training. Here, if I heard you well, you said that you don't know anything about procurement, etc. I just want to assure you that your leaders are aware of this gap. They have approached me at the ministry. Entrance has brought an MOU. Central has done same, and the others have discussed with me the need for us to support you. And I said to them, we are ready to do that, but the numbers. So I proposed that we would do it in batches. How many are you now entrance? Per sitting, like per class. So about 100 of you. What I proposed was that we can have you in batches. Maybe you come to the ministry rather than they posting you to come and stay. In the past, they could come 5 students, 10 students, but there are so many of you. So the point I'm making is that we are in talking to your principals. They are aware of this, and together we'll try and make sure that that gap, not just procurement policy, but there are several other policies that we are working on. It's being worked on. Thank you.
Thank you very much. Rafik, do I have questions online? I don't see it on the, okay. There is a question online talking about teamwork as a physician assistant. Where do I fit? Because I practice knowing and feeling that I am cut off from all the chains and framework of health service machinery. Dr. Justice Youngson. I wish the president were here to answer this one, but the vice president of the GMA will answer that question for us. Thank you very much. Dr. Youngson.
Madam Moderator.
Yes, sir.
For me, my take on this question is that this tells us that we have a bigger problem at hand. Because a practicing physician assistant, if he doesn't know basically where he fits, then clearly we have a bigger problem. And I want to leave it at this.
Exactly.
It tells us that we need to go back to the basics and retune the system. Thank you.
Thank you. Yes.
Just to say something
Professor.
small, yes, it only reiterates the need for stronger teams and respect and to build the teams more. They exist, but we must recognize the role of each team member and what they bring to the table. That's all I want to say.
And I remember I said it, and I'll say it again, that in all teams, there's a team lead. And let us acknowledge that and work and build the teams together. The fact that you are a team lead does not also mean that you are going to lord it over everybody. The rules must be defined appropriately, and all the rules and regulations in governance and leadership must apply. I think that is what I will say.
And Madam Martha, it is, you see, if we ask Prof and Nana here, anybody who has practiced abroad in other jurisdictions, they know how beautiful teams are. And nobody lords whatever they have over anybody. And it's all about leadership and management. And we need better leaders to make teams work better.
All right, thank you very much. I am about to close this meeting, but kicking the motto.
No.
Yes. Another question.
Yeah.
Okay, Stephen Colette, that will be the last I'll take.
Let me.
Physician assistants contribute very well to the health system, especially at the peripheries where seeking healthcare is difficult. Of late, they appear to be neglected. I don't think they are neglected per se. We understand where you are coming from. It is just a build on the earlier question. Like the panelists have intimated, let us ensure that our leaders are talking to each other. I'm glad to say that in the health arena, we have Rectors Forum, we have Deans Forum, we also have President's Forum, I'm told. Professional, yes. And so I think that it begins from there. And then there are things that concern all of us. When it comes to salaries, we can... Oh, we need to agree that the teams must begin to work and know that there is somebody out there who must understand some of these things. And that is why we cannot thank the legend, Mr. Abraham Jesse, for putting this all together to serve as a reminder to all of us that the teams must work. I understand 600 people, more than about 4 times the people in this room are online, and they have their questions coming in their drones. So, ladies and gentlemen, permit me to take 2 more, and then we can bring the meeting to a close. Permit me, please.
Yes.
Mr. Chairman, I understand. Yes. The last posting occurred somewhere in 2019. That's a question. Right now, there are plenty health centers without physician assistants. Achieving universal health coverage put us behind. No one must be left behind. Yes, all problems will not be solved today at this meeting. Is there another one? Rafik? Okay. I'll take the last one. Unfortunately, Mr. Kikimoto, we cannot take. Yes, another one is, please, why has emphasis been placed on teamwork but not ensuring respect for leadership neglected? Can I reword it? We are placing emphasis on teamwork, but we are not ensuring respect for leadership. That is what the question is. I think we have emphasized it in this room, that the teams must be led. There must be a leader. All of us cannot be leaders, but the teams must be built, and all of us must be involved in that exercise and ensuring that each one is bringing something on board. Indeed, each one brings something on board. And so it is what it is. Any other? Rafik, I'm done. No more questions. Ladies and gentlemen, we have been here since 11 o'clock. Before I came up, Na told me that you have 1 hour. And I told him that, oh, we will do less than 1 hour. But I realized that we have done 1 hour and 30 minutes. The chairman is telling me he's traveling tonight. And so I will not attempt to sum up, but for you to know that this meeting, we have been hearing about teamwork being infectious. We have heard about the Nana professor telling us about his own experiences, virtually shared his life with us. For this discussion, we heard about protocols, we heard about procedures, we heard about effective communication, we heard about setups that must reflect teams. We talked about respect, we talked about event-based surveillance, the culture of the people, and the fact that zero tolerance for rabies came up, appreciation of each of the team members, and the big one of leadership. We must learn to lead, and we must be taught to govern. this is where I'll bring this meeting to a close, and help me to thank the panelists, Dr. Justice Youngson, the Vice President of GMA, Mrs. Perpetual Ofori Ampofo, the President of Ghana Registered Nurses and Midwives, Mr. Kwabna Asante Ofe, the Vice President for Pharmaceutical Society of Ghana, Dr. Mrs. Yvonne Yerenchiwa Eseku, Director of Ghana College of Pharmacists, Dr. Lawrence Lati is the Acting Director. Did I get it? I knew him in another life, but this one, we are all moving forward. So he represented the Director General of the Ghana Health Service, and Dr. Boy Kikimoto is a physician, is a veterinary public health consultant, and has done a lot of work in the space. And we are grateful for all your contributions, and they make the meeting a beautiful one. I cannot thank you enough. Please. I think we will take a group photo with the panelists, and we will humbly ask the chairman. We will not come here back up here again. So just for the panelists, please. A quick one, please. Oh, come forward.
Thank you so very much. That was a really, really insightful panel discussion. I believe we've all enjoyed ourselves. We've had the opportunity to think a bit deeper about some of the topics around teamwork as health professionals, and even beyond health professionals, to ensure that we're able to offer our patients, the community at large, better healthcare. For me, it was really interesting hearing from the animal health side of things. Really valid point, and I enjoyed that very much. Thank you. As we bring the program to a close, I'd like to call on the chairperson for our program, Professor Ajiman Bedu-Akosa, to give us his closing remarks.
Thank you, thank you, thank you for all the participants, for the panelists, for all those online. I think that we have benefited significantly from this program put together by Health Development Consult. It is interesting that when it comes to the health sector, we are prepared to at least discuss teamwork and team building. One of the things that we forget is that there's so many other people who are peripheral to health who make our health teams work better or less better. I just want to touch on the word patriotism. If everybody in this country is a patriot, nobody will shortchange in terms of procurement of drugs, in terms of the standard of drugs, in terms of standard of vaccines, instead of standard of anything. But there are so many people who play and lurk around who will make sure that they, for their own benefit, will shortchange the system. And in shortchanging the system brings out a lot of the difficulties we have in our system. Of course, if you're treating people and you're giving people antibiotics, they're not getting better. and they are dying, it's almost as if the system doesn't work. But it is not the fault of the system. It is the fault of those who are being allowed to shortchange the system. So if we in this country are not patriots, we are not prepared to die for this country, then we will create problems at every level of our endeavor. Teamwork is important. I don't hear teamwork, I don't hear the legal profession discuss teamwork. Maybe they do. Do they not have technicians? Do they not have assistants? Maybe they do. But when it comes to health, it is almost as if because the end result results in a loss of life, it becomes imperative that we discuss and make sure we build a proper team. There's no doubt that if the team works, everything is perfect. But there's no system that is perfect. And therefore, if there are nuances, it is for all of us to sit down, talk about it, and build systems. And if Farm Abraham Jesse has been at this for 25 years, it is important that younger people, more agile people, take on this and continue where, from where he has moved the system to. This discussion will not end today. And we will not solve all the problems today. There are nuances everywhere. Laboratory physicians and laboratory technologists, laboratory scientists is there. Doctors, physician assistants. Oh, it's there. But we should all just remember what I said. It takes 69 different professionals to get one child better. If they work better, children will survive. If they don't work better, children will die. And it will not be the fault of one person, but the fact that the 69 different professional groupings are not working as well as they should. So long as Farm Abraham Jesse is alive, teamwork would always be there. He has indicated that there are going to be roundtable discussions, 3 roundtable discussions. They're going to take everything that a patron brought onto the table. And for me, it is the A to Z of all the things that we've talked about. If we open his presentation today and begin to discuss it in the 3 roundtables, we would have a lot to pass on to the Ministry of Health, to share with the world. Thank you very much. Today has been a wonderful day. Long may you live, and long may your advocacy continue. It's been a wonderful day, and I wish you all well. Thank you very much.
Thank you so much, Prof, for those remarks. Ladies and gentlemen, we'll be bringing, again, like I said, the program to a close. I just have a quick announcement. After everything is done, lunch is served, or packed lunch is served where we had the breakfast, just on my left at the right end of the auditorium. So please feel free after everything to just go in and pick a pack. I'd like to call on the convener of the meeting, Farm Abraham Jesse, to give us his vote of thanks, and then we'll say goodbye. Thank you.
Thank you. You've been a wonderful MC as usual. Our dear chairman and my comrade in arms, we started this struggle together. We started with you being the keynote speaker. And today we are continuing with you being the chairman. And tomorrow, I'm sure, we'll continue with a lot more participants in a much larger place. My dear friends, the maximum number we could host in this place was 150, and we are here already. But I'd like you to know that there are a whole lot more people online, not only in Ghana, but elsewhere as well. And the whole idea is that the matter we are discussing is not only for Ghana, it's for mankind. We're talking about One Health. And we're talking about the fact that no one is safe until all of us are safe. And today, permit me to say in usual Ghanaian parlance, yes. As the chairman said, this is not the end of the show. We are planning 3 successive experts roundtable meetings. And these expert roundtable meetings are going to discuss how we can teach teamwork, what we shall teach in teamwork, whom we shall teach in teamwork, and where we shall teach teamwork concept. And therefore, we will be calling upon all those who are here as well as online to volunteer to participate in these various expert programs. And as I said, the idea is that at the end of it all, we should be able to publish a magnificent report, book, whatever you call it, and make this publication available and disseminated it all over the place so that regulators, policymakers, health professionals will know where we stand together, because nobody is safe unless we are all safe. This is the whole idea. So permit me to thank you in the name of God for making this day happen, and it has happened. And therefore, I will have to thank all of us. I cannot do so individually. So please permit me to first single out my chairman and my colleague. Thank you so much. And now, our royal patron. You did not only come to grace the occasion, in fact, you made the occasion happen. And I'm glad that all these wonderful ideas you've expressed will not die, because they are going to be documented and disseminated worldwide. We cannot thank you enough, and the world cannot thank you enough. We are glad that you're here, and please, through you, may we respectfully share our gratitude and thanks to His Royal Majesty, whose foundation you also chair as the whose board of trustees you heard. Ladies and gentlemen, may I respectfully request you, wherever you are, sit down, and let's put our hands together for our patron. Ladies and gentlemen, you won't believe this, but I'm doing all this is at my own expense. I ran this organization as my service to mankind during my retirement, but I've come to the point where I can no longer continue to do so in order to render the service which consistently we are proved to do we can do. Right now, we are producing every month a free online publication that will be reaching sooner than later all of you, but which are already reaching a whole lot of people, to propagate and to promote our concept of teamwork, to share very useful information with all, and we do this every month free of charge. So we are asking all of you not only to remember us in your prayers, but also for whatever it is that you can do to assist us, will be thankfully received and faithfully applied. And in particular, we ask that there are several ways you can do it. And whenever you feel so disposed, please do so. Lastly, may God take us back where we came from safely. May He direct us to meet again in our specialist roundtable meetings, because that is where the actual work is going to be done. And on behalf of myself, Mother Ghana, and the whole wide world, because all of us are going to benefit from what has happened here. Thank you, thank you, thank you. So, on the left-hand side, pick up your lunch pack and do what you want to do with it anywhere you want to do that. And it's because we can't afford a place where we have a sit-down lunch and that sort of thing. But here, some people also kind to us. A caterer decided they would not give us free, but at least at some reduced price. So we have some nice pack. It may not be the best lunch you have had, but it's nutritious, it's safe, and it's nice, and it's tasty. So, if anyone wants to support us, want to make any announcement, please do so. Or if you want to talk to us in private, so be it. Martha, you have always been what you have always been, and you will always be what you have always been. A good administrator, your record is there at the ministry, a good organizer, a good volunteer, and a lady who's always prepared to serve her fellow creatures. May God bless you for all that you have done. Rafiq, please, you're my friend. Come. Quickly. You see the gentleman coming. Oh, don't run. His organization is the, what's the name of your organization?
Continuous Education Services.
What do you do?
We live stream events and then we disseminate continuous professional development programs for health professionals.
So for this forum, what are you going to do for us? What are we expecting from you?
I think so far we've been able to reach almost 2,000 health professionals across the country and
elsewhere.
And elsewhere. And a lot of them are with us online as we broadcast now. And we'll be doing follow-ups with them to give them further information and development updates on.
So what deliverable are you going to give to me so that people will know what to expect?
I will send you an email on that.
Thank you very much. This gentleman is so hard working with his team of very young, agile, and dynamic people. And this is being streamed worldwide. And they are going to give me all the material, the recordings, the photographs, to which each one of you who have registered, you'll be entitled to a copy. And then at the end of it all, after our experts roundtable sessions, everything will be properly scrutinized, put together, and produced into a report in which all our resource persons, their photographs, their CVs, everything will be there, plus the material produced professionally and scientifically for distribution globally. We're not going to sell those documents. We're going to make them available to all universities, all, because we are doing a good thing the world should know. And of course, they should also come and hold our waist so we can climb. As they said, if the mountain was smooth, you couldn't climb it. But we are traveling a rough road and we can climb it because we believe in what we are doing. So keep on spreading the good news. Whenever you get any publication from us, share with all on your platform. God bless you and thank you. And we'll see you in May with first expert roundtables. Any one of you here or online who has particular interest in joining the expert roundtables, please communicate with us so that we can begin to empanel the experts even before we meet. And on behalf of myself, I thank my very special friends and all of you, especially one more time, Nana. I did actually not to say I could be so we will all very quickly go out on the stage there so we can take this memorable and historic picture of all of us present. And with Nana and the chairman in the middle, the rest of us flanked. And I see some very nice youngsters in their professional uniforms. Some of you should be prominent in the front. I want the whole world to see that this was not just big men alone talking, but their students and their professionals, active service, they're also here. Madam Minister for Health for now. you must stay inside the picture. Thank you.